Good morning, everyone. A warm welcome to all of you to this special event hosted by Sitaram Ayurveda, the grand product launch and Acharya Rasayanam magazine release. It is indeed a tribute to excellence, innovation, and the promising future of Ayurveda. Before jumping into the main event, in the ongoing escalation tensions between India and Pakistan, we pause to reflect on the lives affected by the recent conflicts. We remember the lives lost, the families torn apart, and the communities in distress. We pray for the souls of the departed, for the healing of the wounded, and for comfort for those grieving right now. Let us now observe a moment of silence. To begin the main event, the auspicious occasion with divine blessings, we invoke the grace of Lord Dhanvantari, the celestial healer and the father of Ayurveda. Let us now join together in the Dhanvantari Stotra.
शङ्खं चक्रमुपर्यधश्च करयो दिव्यौषधं दक्षिणे वामेनान्यकरेण सम्भृतः सुधाकुम्भम् जलूकामपि बिभ्राण करुणामृत सुखकर सर्वामयध्वंसक क्षिप्रं नो दुरितं छिनत्तु भगवान् धन्वन्तरि पातु नः नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दित पादपद्मम् लोकैर्जरारुभय मृत्युनाशम् धातारमीशम् विविधौषधीनाम् सव्योमवातावनिवारिवह्निम् पञ्चप्रपञ्चात्मक देहभाजम् सन्ताप सम्पात जराज्वरान्तकम् नमामि धन्वन्तरिमादिदेवम् नवीननीलमुदकान्तिकान्तम् शान्तं हरेर्द्वादशमाख्यमूर्तिम् पूर्तिं शतानां सुमनोरथानां नमामि धन्वन्तरिमादिदेवम् नमामि धन्वन्तरिमादिदेवम् नमामि धन्वन्तरिमादिदेवम् शङ्खं चक्रं जलौकां दधतमृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्म स्वच्छातिहृद्यां शुकपरिविलसन् मौलिम् अम्भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गम् कटितटविलसच्चारु पीताम्बराढ्यम् वन्दे धन्वन्तरिम् वन्दे धन्वन्तरिं तं निखिलगदवनप्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम् नमामि पाशाङ्कुश दन्तभक्ष्य संलक्षितम् त्र्यक्षमुदारकुक्षिं नागाननं नागकृतोत्तरीयमुत्तप्त हेमप्रभमादिमूर्तिं हरिसदरजळोका रत्नपीयूषकुम्भ प्रतिघटितकरान्त कान्त पीताम्बराढ्य तनुवसन विराजन्मौलिरारोग्यदायी शतमघमणिवर्णा पादु धन्वन्तरिर्नः शतमघमणिवर्णा पादु धन्वन्तरिर्नः.
To formally welcome you and share the vision behind this initiative, we have with us a distinguished expert in the field of Ayurveda. It's an honor to welcome Dr. Aditya Panikkar, AGM, the driving force behind marketing and innovation at Sitaram Ayurveda. A trained Ayurvedic physician with a keen business perspective, Dr. Aditya combines his deep clinical insight with strategic thinking to bring meaningful innovation to the world of Ayurveda. With his leadership, Sitaram continues to evolve as a brand rooted in tradition, yet aligned with the now needs of the world. Please join me in inviting Dr. Aditya Panikkar to deliver the welcome address.
Good morning, all. Respected dignitaries and esteemed doctors and revered Ayurvedic physicians, all are welcome to this wonderful occasion of the innovations of Sitaram Ayurveda. So it is both a honor and privilege to welcome you all for the innovations in Sitaram Ayurveda. We are looking forward to more evidence-based Ayurveda in this scientific world. So as a first steps, we have come across with an scientific magazine. Its name is Ajay Rasayanam. You all are known about the CMEs we are conducting every Sunday to bring the clinical experience which had in traditional way in different parts of India with the scholars of Ayurveda. The same vision is behind the Ajay Rasayana magazine. In Ajay Rasayana magazine, we are campaigning the clinical experience of expert doctors along with the research articles which we are doing, research activities in our innovation and R&D lab. The same are published in the different national and international journals. These are combined in this Ajay Rasayana magazine. Along with that, we have some exclusive podcast interviews with our director, Dr. Vignesh Devraj. He's doing his podcast for more than 5 years, and this is one of the top 100 rated iTunes podcasts in all over the world. So the same podcast interviews also we compiled in the descriptive manner in this Ajay Rasayanam. So both the scientific outlook and the international outlook of Ayurveda are combined in this Ajay Rasayanam magazine. And along with that, the research activities which we are conducting for our products and along with the classical products, these are all combined in the Ajay Rasayanam. And the 5 new launch products which we are introducing is not more than a traditional way, it is more on evidence-based. All are undergoes severe, serious events of clinical research in-house and outsource also. So we are also doing some toxic study and animal studies with the nationally accredited lab across India. The same is also we are doing with a clinical trial also. So these are research activities which we are actually doing will be compiled in the coming episodes of Acharya Rasayana magazine. So in my heartfelt wishes and for the new Acharya Rasayana magazine and the innovations we are doing with our R&D department. Along with that, I welcome all the esteemed guests and doctors to this wonderful event. Thank you very much.
Thank you, Aditya sir. So, next is the very divine moment of the day. Every auspicious beginning is marked by the lighting of a ceremonial lamp. It is with immense pride and respect that I welcome Dr. D. Ramanathan sir, the visionary managing director of Sitarama Ayurveda, a name synonymous with integrity, innovation, and the authentic spirit of Ayurvedic science. A pioneer in the Ayurvedic pharmaceutical landscape, Dr. Ramanathan sir has transformed Sitaram from a traditional force into a national and international force in holistic healthcare. His leadership bridges a century-old legacy with the future of evidence-based Ayurveda, inspiring new generation doctors, researchers, as well as the entrepreneurs. Every milestone we celebrate today, from the cutting-edge product launches to the release of our scientific magazine, Acharya Rasayanam, bears his unwavering vision and dedication. Without any delay, with great admiration, we now invite Dr. D. Ramanathan sir to light the ceremonial lamp that signifies knowledge, healing, and progress, and also to deliver the keynote presidential address thereafter. I also invite all the other esteemed guests to the stage for the most significant moment, the light lamping ceremony. I invite Dr. Shyama Krishnan, retired District Medical Officer, ISM Department. Dr. T.S. Jayan, Founder and Chief, Madhaviyam Hospital, retired Joint Director, ISM Department. Dr. Ravi B. Unithan, former District Medical Officer, ISM Department, CEO, Unithan's Ayurvedic Hospital and Research Center, Chennai. Dr. V.K. Shashikumar, Medical Superintendent and Senior Consultant, NS Ayurvedic Hospital, Kollam, retired District Medical Officer, ISM Department. Dr. C. Suresh Kumar, Managing Director and Chief Physician, Triveni Nursing Home, Trivandrum, Professor of Shalya Tandra, Pankaj Kasturi
Good morning to everybody. Today the Siddharam Ayurveda it started 1921. My grandfather had a small unit at Tichur. My mother's father, brother, he was a very eminent physician also, as Gopalakrishna here. You heard that one of the famous first South India textile mill is Siddharam mill in Tichur, including most of the politicians started the career from the Siddharam mill. That is history. That is that time in Tichur, Pugunam, one of the leading temple, that is Siddharama. The only temple you see in the world, you see Rama and Sita on the one temple inside, only temple in India, that is Pugunam temple. That is why they are giving the name of the Siddharama with the blessing of the Cochin Maharaja. He is also interested, he is very close to my grandfather at the time. So, with the interest of the start, it has started the first limited company, public limited company in India is Siddharama Ayurveda, in first limited company, public limited company, joint stock company. That is a missionary. But that time my grandfather is very strict, the quality as well. Without quality as well, he has not compromised. So that time he spent loss of the money. And what happened is a limited company. The shareholders always interested not for quality, they are mainly interested for the profit. So some different opinions started because they want the money, without profit, how to live future of this industry. But my grandfather not compromised, he has resigned this post. And after some black noise there, and my father took the charge. In that time, we have the 13 members in my family. I am the 12th man, 13th member. That time, that is a 1970, 67 time. All the brothers, 3 or 4 brothers, joined the Trivandrum Ayurveda College, Punithra Ayurveda College, and Kottakkal Ayurveda College. All are joined. Within 2 days, they left and came to the house and joined to medical college in engineering, all the things. And luckily or unluckily, that time I was sick. So I got the 3 admission. One is Shornur and Punithra and Kottakkal. But all on the postal, that day is coming the postal. I saw that immediately from then, wait. But my father is very much interested to push to me to Ayurveda. Then that time my brother, father, sister, husband is a law commission chairman at Trivandrum. So he is very close to this Ayurveda college and he invited me and daily monitored to go to the college and they started the college that time. That time I had a very bad experience. That time we need a fitness certificate. One of the leading doctor, Dr. Kunyan is there, he is in Tichur. Then I went to go to the certificate, medical fitness certificate. He called my father. It means very close to God. Mayor, I am not signed. You don't send this boy into the Ayurveda. This is a dead science. You don't send that love of Rashid and here don't give me the certificate also. So I am going to be happy because I have one supporter. But unfortunately, my father go to another B class, Bhaskar is there. Yes, signed and joined there. So that time I am not interested to study there. Why raise the issue? Today, why raise, very particularly the race? The first year, due to this mental block, I am not interested to study the Ayurveda. I want to quit this subject. And first year, I lost all my subject. Today, I had an experience. You know, Dr. Sarojini experienced it. She called me and sit with me and told the future of Ayurveda. So, only because of that Sarojini influence, I realized that. Then I continue my studies there. So, first my request, all are stand up. The great beloved, our teacher, is for the Shanti there. Sit down. Why I raise the issues there, some turning point, definitely we need a guru. So she is very much interested in the temple visit. All the time he is going to Guru Ayur. And all the six, she is very much close to Sirsa temple. That is, at that time I accompanied to, including the Kumara, one temple, beautiful temple, she invited me to go there. That type of relationship, only because I came to the Ayurveda. And after that I studied the Ayurveda. Why I raised the issue, I think some new students are here. That time, Ayurveda college, the admission is very poor. That time I heard that time some people is calling to the, when then send it tomorrow, Ayurveda college admissions there, anybody is interested. That I think you may arrange that level of the level. Now what is the standard of the Ayurveda? So then Ayurveda is growing very well, and modern system and Ayurvedic system close together. And internationally, we have, compared to the WHO, they are agreed on three systems. One in Ayurveda, another is homeopathy, and third one is a Chinese medicine. So why the Gujarat, that is WHO started the branch at Gujarat, only because they know the 5,000 years of our experience, history. So they have a very good chance for the potential for the alternate complementary system of medicine only for Ayurveda. So nowadays we have, yesterday also we have a meeting at, we are, our association, we have a magazine Aushadam, 24 years, last and that is a celebration yesterday. The minister also, higher education minister also inaugurated that function. Then we raised the present situation. We have enough research papers, but very unfortunately, some people mentioned that particularly interested. This research papers is not that pre-reviewed level of the research papers. It is a research level is some influence that level of the professional research papers are not available in the stage. So that is also we are facing one problem. That is, I go to the Wikipedia. Then Wikipedia, you see that 1, 3 and 4 journal they are mentioned that is Ayurveda is pseudoscience. Then I want to remove this, we want to remove the pseudoscience and went to Supreme Court. Then Supreme Court mentioned that you can edit anywhere. There is any chance. Don't worry about the editor. And after my fight, some changes in there. But still, last 2.5 years, I think that is right persons are here. That is our Suresh is there, Dr. Jain is there, Shyama Krishnan, Shachikumar. You have done good jobs, but we are not able to last 2 years. One single journal included in the Wikipedia. That is, we are facing another problem. Why the reason? We have enough journals are there, which is some standards, a pre-reviewed journal, some standards there. We cannot able to collect which is the best one. That is not, still we are waiting for that. So we want your help also. That is why we have started the Acharya Rasayana magazine only, but that's the purpose also here. We are raising the issue. We need a number of the more than 60,000 available of the Acharya journals, scientific journals are available in the now. But we are facing the problem that is a pre-review journal. How much time that is review? That lack now is there here, but we are not identified. So I think we can help it. So you give me some, which one good one? We can able to put the Wikipedia. So what is the answer for the present scenario? You go to the Wikipedia, journal 168, 169, 170. This is a scientific journal. That is enough. So we can able to establish all this foolish method. We can able to prevent this only because we have, but we not proactive. We are all proactive. I will not say that and you are proactive, but we need more proactive and to identify the journals and put the pre-review. Why I raise the issue, sir? This is a common issue. Siddhara Ayurveda is a common issue. The Siddhara model is supporting that. Ayurveda is a very good future, no doubt. Suppose you are study properly Ayurveda, fundamentally, don't mix it for the modern system. Everything you go to the Ayurvedic concept, you identify these doctors are there. Jain, he is one of the best specialists in Marma and Panchakarma, and Dr. Jain, and Shumar also, Kai Jilsa, she also, Dr. Riddhi Unnitan, is very much interested subject-wise. All are got the classical Ayurveda. That is the beauty of these five people. They are concentrate of the classical fundamental Ayurveda. Don't mistake the Ayurveda. That is the difference. Now what happened? Now you go to the market. This is another problems are facing. Suppose this way you are going to continue the system. Ayurveda survival also difficult. The Ayurveda main problem, not at all the criticization of the social Syria. It is our own some changes also required, because we are now to change to the classical to patent proprietary medicine. What is the evidence for this proprietary medicine? So at least 50-50, at least 60-40, 50% classical product, 50% PP products. Then also, now it is changed to 20-80. That is the difference we are facing now. 20% classical, 80% proprietary medicine. So what happened in the future? Why the Ayurveda, Kerala Ayurveda is more popular? One of the main reasons, the classical medicine support. So I think take that long time, don't be missing. This is a very informative subject. Why I raise the issue? We want one intelligent thoughts. We have good future, no doubt. We have improved anything we can manage. Some British 200 years back, British people want to collapse the Ayurvedic system. They are collecting our own capacity. They are flourish. You don't worry. That is a change of the calendar or time. So we can come again. We have very good future. Thank you. I am inaugurated the 234 Acharya Rasayana and our Acharya Rasayana magazine. I am also welcome the eminent speakers are there. Thank you very much.
Thank you, sir, for such insightful words and also letting us know the issues regarding the Ayurvedic physicians as well as the science. So now comes the moment we have all been waiting for, the official launch of Sitaram Ayurveda scientific magazine, Acharya Rasayanam. So telling about the magazine, it is literally the scientific voice of Ayurveda. It is a transformative moment in the journey of Sitaram Ayurveda, the launch of Acharya Rasayanam magazine. It is a magazine born from a vision to give Ayurveda a powerful scientific voice. So rooted in the timeless concept of Acharya Rasayana, which speaks about the righteous conduct, clarity of thought, and a life aligned with nature. This publication stands at the intersection of classical wisdom and the modern science. Acharya Rasayanam is not just a magazine, it is a movement. A movement to document, question, explore, and elevate the practice of Ayurveda with clinical rigor, pharmacological depth, and the real world insight. Coming to the magazine pages, you will find original research, expert case studies, product pharmacology, and the lived experiences of seasoned Ayurvedic physicians, all curated to inspire a new era of evidence-based Ayurvedic practice. As today, the volume 1 is getting released, we invite the entire Ayurvedic fraternity to be part of this intellectual renaissance. I again invite Dr. D. Ramanathan, Managing Director of Sitaram Ayurveda, to officially unveil and launch the magazine. New Ayurveda products. A perfect blend of ancient healing principles and scientific innovation. These products has been created with great care, extreme research, and love. Today, we are unveiling 5 breakthrough Ayurvedic formulations, each crafted with clinical insight, classical wisdom, and some modern relevances. So let us know about the products as well. Cough Sap SF, a sugar-free cough syrup designed for diabetic and wellness conscious patients. Flexi Cough Gel capsules, targeted support for psoriasis, combining anti-inflammatory and the third one is Sap Rono, a fast-paced for muscle and joint perfect for both clinical use and Masharjat, a safe and effective Ayurvedic hospital-friendly digestive sap syrup, a digestive tonic to relieve indigestion, bloating, and loss of appetite across age groups. Once again telling about that, these products represent the commitment to evidence-based Ayurveda that heals, supports, and fits seamlessly into modern life. Thank you so much. As you can see, these products were very much displayed in a traditional way in an ornated box, Amada Petti. So coming to this beautiful products, we also want to know about this scientific side, right? So to tell us more about the journey behind these products, its ingredients, benefits, and the scientific side that supports it, I now invite the innovation team of Sitaram Ayurveda for the scientific session, highlighting the clinical efficacy, the pharmacological relevance, and the traditional basis of these products.
Good morning and a warm welcome to the grand unveiling of Sitaram's next chapter. So today we have witnessed 5 new products of Sitaram Ayurveda. These all are evidence-based products. So we will go through quickly to the scientific validations we have done for these products. So next. So the prevalence of GERD in urban area is almost 16%. The main complications are the burning sensation, loss of appetite, and bloating after every meal. So for these problems, we have developed a product named Digestive Sap Syrup, and it's reignite the acne and relieve discomfort and restore acne in your digestion. So these are done through the scientific validations, and the major contents of this digestive sap is Trikkattu, Ajamoda, and Chincha and Jeeragam. This is ideal for both kids and adult, and the dosage differs from for kids 5 to 10 ml, for adult 10 ml to 15 ml. So it's the clinical problems which it is always the enhance acne, reduce ama, and improve appetite. Now our research officer team will develop, present the clinical validations we have done in these products.
Good morning everyone. Myself Dr. Sridevi AP. I am here presenting Digestive Sap Syrup. We published 2 articles related to this. First one is physicochemical and then next one is clinical. And I will go through the first study. Here the standardization and quality study we conducted for the Digestive Sap Syrup. And then moving to next slide. Here, what standardization matters? Here, the digestive syrup is having ingredients of Triggadu, Chinja, and then Hingu, etc. And then here we have herbal quality varies. Hence, the standardization is critical for the digestive syrup. So, this study will promote the Ayurvedic and modern innovation. And here we conducted a study for LCMS study. Next slide. Here we conducted organoleptic and physicochemical evaluation, and also the phytochemical screening, and also the microbial testing, and then TLC, and also conducted the LCMS study. Moving to next slide. Here we have conducted the physicochemical profiling of digestive sap syrup, and then pH is 3.94, and then total soluble solid is 64, and then total sugar is 58.67. Here the physicochemical parameters is conducted in graphical representation. And moving to the next slide. Here we conducted the phytochemical findings for the digestive syrup. Here, the ingredients in the bioactives include flavonoids, phenols and glycosides and sugars, and quinones and steroids and alkaloids. And here it's validating that the digestive having digestive enhancing and anti-inflammatory properties. Moving to the next slide. Here we conducted the microbial study for that, and then E. coli, Salmonella, Pseudomonas, and then Staphylococcus are absent. So hence it's proven that the microbial it's safe for use and microbial free. And moving to next slide. Here we conducted the TLC of this digestive syrup, and then it's proof that contents of Tippali and then Chinja and Dhanyagam, etc. And then LCMS identifies that carminative phytochemicals, and then we can prove that it's having a therapeutic efficacy by analyzing LCMS and then TLC, etc. And moving to the conclusion, here the digestive syrup is scientifically validated formulation. It's safe for use and palatable, and it's good for appetite and then gut health, etc. And second study we conducted is clinical study. Moving to the clinical study. Here the clinical study is conducted for digestive syrup in our hospital, and then it's a 30 patient study. Moving to the next slide. Here, as we know that appetite affects 20 to 30% of chronic disease patient in India, leads to malnutrition, weight loss and poor immunity. And we conducted a digestive clinical study for 30 patients. Moving to the next slide. Here we conducted the study for a single arm open label pilot study. Participants were 30 patients, and then the age group of 15 to 60 with a poor appetite, and dose is 10 ml with twice daily. And then moving to next slide. Here the outcome will be there, that hunger improvement, that is before and after treatment. Hunger will be, the hunger score is improved, like that graph is showing that hunger is improved. And moving to next slide. Here also we assessed the stool consistency, and before treatment we have the constipated bowel, and after treatment the bowel consistency is changed to normal, and loose appetite is absent. Conclusion, here the 57.3% is improvement in appetite score, and then 73.3% is achieved with normal stool consistency, and no adverse effect is reported. And here the digestive syrup is promising Ayurvedic solution for appetite and gut health. These are two studies conducted for the digestive syrup, and we can conclude that it's scientifically validated. Thank you.
Thank you. The next product was sapling roll-on. The sapling is already available products in liniment form. So now we have reworked on and into form more convenient one is sapling roll-on. So it is in no package form, and the sapling is based on cotton chukadi oil and Gandapura Thailam, and it is having a non-greasy appearance with the sapling roll-on. And it is used for joint stiffness, and it is having a very good feedback from almost 8 years. So we now developed it in a new design format. It's a quick relief and deep penetrations Ayurvedic care products. So the key herbs are cotton chukadi, Gandapura Thailam and eucalyptus oils. So now we will go through the clinical trials we have done on sapling roll.
Good morning all, myself Dr. Anu Joy, Research Officer, R&D Department, Sitaram Ayurveda. In Sapling Plus Roll-On, we have published one article regarding the clinical study, which is in a peer-reviewed journal. The entitled article is Evaluation of the Efficacy of Sapling Plus Roll-On in the Treatment of Acute Myalgia, a Prospective Open-Label Single-Arm Clinical Trial. Then the acute myalgia affects the 25 to 30% of Indian adults, which is conventional. The conventional pain relief methods are available, but it's have the adverse effects and risk. So Sapling Plus, which is herbal, safe and non-invasive alternative grounded in Ayurveda. we selected 100 patients with acute myalgia, and we provided the Sapling Plus roll-on for application in 3 times per day, application for 7 days. The tools was VAS, visual analog scale, and ODI, which is Oswestry Disability Index, and PGA is Patient Global Assessment. We checked the outcomes, that is pain reduction, mobility, and the patient satisfaction. The next, the pain intensity reduction as shown in the figure, which is tremendously reduced. The clinical results as VAS score has dropped from the 6.8 to 2.1 by day 7. And the ODI reduced from the 38.4% to 12.6%, and 92% of the participants were satisfied for highly satisfied. There is no adverse effects are reported on the study. So, we can conclude that Sapling Plus roll-on provides a fast, effective relief for the muscle pain and clinically proven to improve the mobility and reduce the disability. So, a safe, well-tolerated alternative to NSAIDs for acute myalgia. Thank you.
Thank you. The next product is Mashak Jal. The Mashak Jal is a mosquito repellent Ayurvedic cream. So there are many mosquito repellent creams are available in the market, but they are based on chemicals and some of them are carcinogen. So based on these problems, we have developed a completely Ayurvedic mosquito repellent cream. It is safe to use for kids and adults. So this is also in a roll-on formula. You can see here. It's an herbal sheet and it's made up of aranda oil, lemon grass oil, and tulsi. So it is also showing very good result. The clinical trial results will be shared by the research officer.
Here we conducted the Mashak Jal clinical study for 50 children, and here the study titled have a comprehensive evaluation of Mashak Jal, a novel pediatric and mosquito repellent formulation. And then why Mashak Jal? That as mosquito-borne diseases are prone serious risk to children, and then this having ingredients like aloe vera, tulsi, lemongrass oil, etc. And then here we conducted a study for 50 patients, that is children with the age of 1 to 12 years, and then the duration will be 15 days, twice daily application. And then here we assessed the efficacy, safety, and sensory acceptance. And then moving to the graphical representation of outcome, here the outstanding efficacy of grades will be analyzed, that is according to the score. That grade A plus score we analyzed with 32 to 35 scoring, and then grade A 25 to 31 scoring, that is 50% of participant having grade A efficacy. And then moving to next graphical representation, here we shown the long lasting protection, that is most of them having 4 to 6 hours long lasting protection for our product, that is Mashak Jal. And then moving to next slide, here 82% of achieved the grade A or A plus efficacy, and then 70% is experienced 4 to 6 hours of protection, and then also confirms that the no adverse skin reaction is reported, and 88% of parent satisfaction also we noticed, that is proving that a safe and effective formula for Mashak Jal. This is the study, clinical study conducted for Mashak Jal. Thank you.
Thank you. Next product is a FlexiNex soft gel capsule. So the FlexiNex soft gel capsule is an cutting edge product. So actually when we talk about FlexiNex, this product was actually developed through machine learning. So we have processed the data of the classical formulations, and through the machine learning model we developed this formulation. It is actually giving very good result in 7 days through your by providing our sample through the executive. You can usually feel that. So this is a main reason for taking this type of problem is that almost 10 million of Indians are affected with cervical spondylosis. So the problem is having a large scale, so we want to develop an unique formulations that will be benefited within a short span of time within herbal formulations. So we developed a FlexiNex softgel capsule, and I think this machine learning models can be used for the formulations in Ayurveda. That is also we come across to the developing this FlexiNex capsule. The clinical trial data will be presented by the research officer.
Regarding the FlexiNex softgel capsules, we have published 3 articles on peer-reviewed journals. The first one is Therapeutic Potential of FlexiNex softgel capsule, a GCMS-based evaluation of bioactive compounds. So the cervical spondylosis is a chronic degenerative spinal disorder. The FlexiNex softgel capsule are a herbal alternative offering the anti-inflammatory and analgesic effect. The GCMS analysis confirms the presence of the key therapeutic phytochemicals in the FlexiNex softgel capsule. Then we have conducted the study methods as the formulated for the GCMS. Then the bioactive compounds are identified, that is 9 in number. The alpha cytosterol is the highest amount. And the key findings was the beta cryophyllene and the gamma cytosterol, which is having the analgesics and anti-inflammatory along with the neuroprotective action. And N-hexadecanoic acid and octadecanoic acids are also presented in the FlexiNex softgel capsules, which is having the anti-arthritis and wound healing properties. And copain and stigmastin is also present, which is having the antioxidant and antimicrobial activities. So this compounds exhibits the synergistic effects supporting the FlexiNex pain relief claims. So when we conclude, the GCMS validate the presence of the active molecules in the FlexiNex softgel capsules, which supports the use in the cervical spondylosis, fibromyalgia, and musculoskeletal pain, so which affirms the FlexiNex therapeutic strength as a safe and effective Ayurvedic formulation. The next study is the quality evaluation, that entitled with the physicochemical characterization and the quality evaluation of FlexiNex softgel capsules, a polyherbal Ayurvedic formulation for cervical and joint support. So the evaluation parameters were the organoleptic and physicochemical analysis, phytochemical screening, along with the TLC, microbial, heavy metal, pesticide, and aflatoxin testing. The physicochemicals are highlighted as shown in the figure, and the key findings were the phytochemicals which are present are the carbohydrates, sugars, glycosides, steroids, etc. The TLC shows the consistency with the key herbs like eranda, gugulu, and bala. And the microbial, heavy metal, pesticide, and aflatoxins are not detected. So we can conclude that the FlexiNex softgel capsules are scientifically validated for safety, efficacy, and its stability. So patent contaminations-free Ayurvedic formulation for managing the cervical and the joint health. And the third one is a clinical study, which is entitled The Efficacy, Safety of FlexiNex softgel capsules in the Management of Cervical Spine-Related Disorders, an open-label, randomized, non-comparative clinical study. The study designs as open-label, randomized and non-comparative clinical trials with 50 patients with cervical spine disorders. The duration was 14 days, then dose is 2 capsules twice daily. The assessment tool was VAS and symptoms and along with the safety. Then we can see the pain reduction before and after. It shows that there is a great pain reduction after the treatment. The clinical result is as the mean pain score reduced from 7.15 to 2.2, and in 50% of achieved the complete pain relief. 30% of the patients showed the substantial improvement and 20% reported with the moderate improvement. This shows the FlexiNex softgel capsules demonstrated excellent pain reduction and were well tolerated. It combines the classical Ayurveda with the modern delivery and promising solution for cervical musculoskeletal pain relief.
Thank you. The last products today we unveiled is Cough Syrup, sugar-free cough syrup. So all we know that India is a diabetic capital all over the world, and the number of patients opting for sugar-free cup syrup is large in number. So we have developed a sugar-free cup syrup which is more palatable and safe in use. So we have developed the Shimula-based COPSAP SUP, which is having a great result in diabetic cough-related patients. So these are last products today is unveiled is COPSAP SUP. The clinical trial data will be shared by the research office.
We have published 2 articles regarding the COPSAP SUP cup syrup. The first one is the clinical evaluation of the COPSAP SUP cup syrup for the persistent cough relief, a pilot study. The persistent cough impacts the quality of life and the daily functioning. The sugar-based syrups are unsuitable for the diabetic patients. Thus, we Sitaram Ayurveda have selected the COPSAP SUP, which is sugar-free Ayurvedic alternative with the proven efficacy. The study design was the open-label single-arm pilot study with 30 diabetic patients aged from 35 to 60 with a persistent cough. The dose is 10 ml twice daily for 2 to 4 weeks. The assessment tool is LCQ and CQLQ. Means LCQ means Leicester Cough Questionnaire and CQLQ means Cough Quality of Life Questionnaire. We can see the improvement in symptoms and quality of life from the graph, and the key outcomes as LCQ is improved from 14.2 to 20.3 and CQLQ which is inversely proportional as 10.4 to 4.2. The hoarseness and breathlessness and bronchospasms, a significant improvement is visible. 80% reported better sleep and reduced the absenteeism. No adverse effects are reported in the study. So we can conclude that COPSAP SUP is an effective sugar-free Ayurvedic remedy for persistent cough in diabetes, and it improves the symptoms, quality of life and patient complaints, and safe and suitable for long-term integrative respiratory care. The final article which is published on the COPSAP SUP is Standardization and Safety Evaluation of COPSAP Sugar-Free Syrup, which is integrating the Ayurvedic principles with the modern analytic techniques, where the organoleptic, phytochemical, physicochemical and TLC along with the GCMS analysis, microbial safety testing are conducted, and the key bioactive identified is 9 in number. On that, cyclohexanol is the highest amount, which is having the antitussive and anti-inflammatory actions, and the thymol, which is having the broad spectrum of antimicrobial and antioxidant activities, and other compounds like dodecaine and hexadecanine and heptosine as having the supportive therapeutic actions for the antitussive. And we can conclude that the COPSAP SUP syrup is a well standardized sugar-free Ayurvedic formulation which is validated for the stability, phytochemical richness, and microbial safety and bioactive efficacy. The reliable and palatable remedy is bridging traditional wisdom and modern expectations. Thank you all.
Thank you for joining us today for this unveiling of our new products. And these all products are evidence-based products, and our R&D department is approved by DSI, Government of India, and our IEC, Indian Ethical Committee, is also approved by Government of India. So we do the clinical trials in our own lab as approved by the Government of India. And so we hope that these all evidence-based medicines will be prescribed by your esteemed doctors. Thank you very much.
Thank you, Dr. Aditya and team. It is quite clear that we have got a clear understanding on how these products will be working and the scientific basis as well. So next is a very golden opportunity for everyone to participate in this panel discussion. We have the esteemed panelists Dr. Shyama Krishnan, Dr. T.S. Jayan, Dr. Radhi Unithan, Dr. V.K. Shashikumar, Dr. C. Suresh Kumar and Dr. D. Ramanathan already seated on the stage. I now invite the moderator, Dr. Ramya, Vice Principal, Ashtanga Ayurveda, to begin the session.
A very good evening to all. Good afternoon to all. Chaturmukha Samarambham Vagbhadacharya Madhyamam Asmadacharya Paryantam Vande Guru Paramparam Ragatirogan Satatana Shaktana Sheshakaya Prasadana Sheshan Autsukya Moharatidan Jagana Yu Apurva Vaidyaya Namostu Tasmai. So invoking the blessings of all Acharyas of Ayurveda, once again I think we started our journey in Acharya Rasayana during the COVID period, and it is 234th episode of Acharya Rasayanam, and we are extremely happy to have doyens of clinical practice from Kerala with us to discuss a very important area that an Ayurveda physician has always to deal in his day-to-day practice, vertebral care. So when we think of the spine care as an Ayurveda physician, our Nidana, Purvarupa, Rupa, Samprapti analysis, I think as all practitioners, we do understand dealing cases that it ranges from Pakvashya Gadavada, it can be a part of Arshas, Katigraham, Parshvagraham, Parshvaruk, etc. is always a part of different Purvarupa, Rupa of Arshas, the spectrum of Gulmam, the spectrum of Grahani. Moving from that, the Abhyantara Roga Marga to the Rogamargam of Madhyama Rogamarga, from the Samavada to the Vadarakta to the Vatavyadi spectrum. So when we think of the spine care as an Ayurveda physician, I think all these areas come to our mind, and all our masters over here, believe that they all agree with me, because it is actually the case which comes to us, makes us to understand what actually is the Samprapti that we need to analyze and carve out the best, safest, cost-effective and the easiest way for making the patient come back to his normalcy. So in that aspect, I think today's discussion on vertebral dealing, rather I think all our panelists were initially will be given an opportunity to share their most revered clinical case experience with all of us, which will be followed by a discussion wherein you can raise your doubts. Our team, our participants of the Acharya Rasayanam who are with us in the Zoom platform can ask their questions. We'll be dealing with that. So we'll begin the panel discussion. And I think remembering all the soldiers, our armed forces who are actually fighting for us, and we are here safe. So when I think Wing Commander Vyomika Sen and Colonel Qureshi, Sophia Qureshi, where they're representing Operation Sindoor, I think giving all respects to them, I would, with all your permission, sir, would call upon Ratibi ma'am as a female representative from the group, and we do have many females more, and again, remembering all those wives who lost their husbands, relatives, children, etc. in the issues that's presently going on. With all your permission, I would call upon Ratibi ma'am to share her clinical experience with us. Ma'am, please.
Good afternoon to everybody. I will take this moment to congratulate Dr. Ramanathan for publishing a scientific magazine and unveiling good products. Then, mastering of the spine and transformative cases is today's our subject. About transformative cases, I have successfully handled a number of transformative cases in my experience. Cases ranging from disc have been treated effectively. Patients at various stages, those are able to walk and those are on wheelchairs, by ambulance or stretcher, have been treated and cured. We have achieved successful outcomes in cases with spinal canal diameters of less than 4.2 millimeter. In particular, 12 cases of non-structural scoliosis were brought to complete normalcy. In idiopathic scoliosis with structural deformity, we are able to make significant improvements as measured by COPS angle in almost 6 cases. Numerous cases of lumbar spondylosis, including those recommended for surgery by modern medicine, have been successfully managed. Conditions such as uncovertebral hypertrophy and ankylosing spondylitis were treated symptomatically, and patients are now leading normal lives. Follow-up is also going on. Cases of nodal migration, cranial migrations were treated with great success. One patient, after treatment of cranial migration, conceived twice and had normal vaginal delivery. She is now leading a happy life with her 2 children. Limited number of fracture cases were also treated. Cases involving clumpsing of coda equina and spinal cord flattering have been managed successfully. We have also managed 1 cases of hanging attempt successfully. And they have presented that case in palliative care of Acharya Rasayana session. Accident-related cases involving cervical fractures were treated with positive outcomes. Cervical myelopathy, myelomalacia cases were also successfully managed. Calcified disc cases have also been treated. In my clinical approach is patient-centered, tailor-made approach. The important treatments I am using is Chincha Levana Sweda, Marmaki, Ushma Sweda, Muttaki or Anda Sweda, Patra Podala Sweda or Ilaki, Kayasegam or Pirichi, Kadivasti, doing with the Dhanyamlam is with the Thylum and different types of Thylums. That is my speciality. Avagaham is the another treatment modality. In case of Vasti, Yoga Vasti, Erandamuladi Vasti, Churna Vasti, Panjadiktaka Shira Vasti, Raji Abhana Vasti, and the last Uttara Vasti is also doing. Shastika Pinda Swedam, Shastika Anna Labam, Swarasa Thara, Marshanasya were incorporated as part of the treatment of these ailments. The special foodstuffs we are giving is the soup prepared by lady's finger and Ajamamsa. Special medicines I am using is Ashwagandhadi Lehyam, Kharjura Rasayanam. It is prepared by myself. Pravala Bhasma, Risasundura, Apraga Bhasma, Trayodashanga Gulgulu, Laksha Gulgulu, Panchadikta Krida Gulgulu, Sorna Gulgulu are also used. Why this case is present here? Because this patient had to suffer a lot of pain and suffering. All symptoms were present in this case. Not only that, a famous hospital in Kerala said that there is no other way but surgery is the only option. Her conditions were not suitable for an operation, so we decided to take this case. This was a challenging case, so I thought it would be the best case to present before you. Now, a 63-year-old lady presented to our hospital in a depressive mood, complaining of pain in the lower back radiating to the posterior aspect of the right lower limb extending to the plantar region for the past 1 week. The pain was of sudden onset and described as a catching type of pain. It began abruptly 1 week ago while she was bathing. She was immediately taken to a private hospital in Kollam, where she was consulted by specialists in neurology, general medicine and orthopedics. Neurological medicine, NSAIDs, skin traction and tranquilizers was prescribed, but there was no relief. She was unable to walk, sit, stand, bend or turn and could not lie in the supine position. She experienced severe muscle cramps and was managed symptomatically. But the pain persisted. Even after taking a dose of tramadol, an injection, she could not sleep due to the severity of pain. After 7 days of treatment, during this recent episode, surgery was suggested as last resort. However, the bystanders opted for Ayurvedic management. Due to the severe pain, she was unable to stand, sit, or making the intake of solid food difficult, and she was on a liquid diet. She also had comorbidities including diabetes mellitus, 13 years history, hypertension, and dyslipidemia, which worsened during this period. Her blood pressure rose to 180/120 millimeter of mercury, and her blood sugar levels spiked to 450 to 500 milligram per deciliter. Inadequate fluid intake led to a urinary tract infection as well. At the request of her family members, she was discharged from the private hospital after 7 days and was admitted to our hospital for further treatment on 24/6/2023 at 9 a.m. 6 months ago, she had experienced a similar episode of severe pain. An MRI was performed at that time, which revealed significant disc bulge. L1 to L5 there was disc bulges. Spinal column diameter at L4 and L5 was 8.9 millimeters, and L5 and S1 was 7.5 millimeters. Foraminal narrowing, lateral recess narrowing, nerve root compression, hypertrophy, all was present in that MRI. Then, why Ayurveda? The family of the patient has a stream of doctors from modern medicine as well as Ayurveda. They discussed among themselves and came to a conclusion that since the patient is not having paresthesia, tactile sensation is present, and bladder control is also present, there was uncontrolled diabetes mellitus, hypertension, and dyslipidemia. And considering the patient's age, it was 63, they opted for Ayurveda to modern medicine. They called us and had a detailed discussion. And after verifying the records, we decided to admit her and treat her in our hospital. Hurdles and challenges we had to face. Patient was brought in by ambulance and was taken to the hospital in a stretcher. On physical examination, it was found that she was not able to sit, stand, turn to sides, and lie down in supine position. She can only lie down in prone position. There is wasting of hamstring muscle, vastus lateralis, scoliosis muscle, and quadriceps group of muscles. In right leg, reflex of right foot is mute, and on left foot it was exaggerated. Weakness of right hand was there. No other special test was performed considering this situation. She was taking food in prone position with help of a pillow placed under the chin. She was having absolute constipation for 7 days, and on treatment aspect, we were not able to give Vasti in a large quantity and considering the position, and she was not able to push also. And on examination, anus sphincter was very lax. She was having external hemorrhoids. Comorbidities, DM, hypertension, and dyslipidemia. Ongoing medicines, Renier, Ceradol, Omega-2, Metformin, insulin, 10 units in evening. Now, the MRI, LS spine on 21/6/2023. Partial sacralization of L5 vertebra, small, well-defined T2 weighted image and T1 weighted image, intense lesions noted in L2 vertebral body, suggestive of hemangioma. Degenerated broad-based disc protrusion with the right paracentral disc protrusion, ligamentum flavum hypertrophy, bilateral hypertrophic facet joints, facet joint arthrosis at L4, L5 level causing coda equina compression, spinal canal stenosis, bilateral neural foraminal and lateral recess narrowing, right is greater than left with moderate compression on right traversing nerve root and mild compression on left traversing nerve root. Degenerative, moderate diffuse annular disc bulge at L4, L5 level causing indentation on ventral thecal sac. Neural foramina and lateral recesses are narrowed on both sides with a mild compression on traversing nerve roots. Annulus fissure at L4, L5, L5, S1 level. Whole spine screening was also done. Degenerative broad-based disc osteophytic complex at C5, C6 and C6, C7 levels causing indentation on ventral thecal sac. Degenerative broad-based disc protrusion at D5, D6, D6, D7, D7, D8 levels causing indentation on ventral thecal sac. Degenerative moderate broad-based disc protrusion at D2, D3, D3, D4, D8, D9, D9, D10 levels causing indentation on ventral thecal sac. Urine routine and culture 1923 significant growth of Klebsiella. Then discussion. Cervical, lumbar and dorsal vertebrae had degenerative changes and disc protrusions. Lateral recess narrowing, neural canal narrowing and spinal canal stenosis was present. Coda equina compression was there. D2 to D10 vertebrae. Degenerative broad-based disc protrusion was there. C5, C6, C6, C7. Degenerative broad disc osteophytic complex was there. And was also annulus fissure L4, L5 and L5, S1 level. L4, L5 anterior posterior canal measurement was 5.6 millimeter. L4, L5 traversing nerve root had mild compression, constipation and external pile mass was there. Condition of the patient was such that she could not be moved. And as such treatments were designed in such a way that movement is not needed. Chinja levana sweda and kadivasti with the dhanyamla were started. Role of dhanyamlam and chinja levana swedam. Dhanyamlam is ushnaviryam and shidasparsham, shobharam, and it is a fedi dravya. Chinja levana gives antispasmodic action and it then generate deep penetrating heat. Both are Vada, Kapha, Hara. Treatments done. Internal medicine selected was Sahajaradi Kashaya along with Dhanada Nayanadi Kashaya BD, Trayodeshanga Gulgulu 1 BD, considering her pain, Flexion and Perment 001 was given Flexion 1 BD and Pylif ointment was inserted. Considering the degenerative changes, Bocomodio was given and to control the diabetic mellitus and the sugar level, Kirata Dictagam was given. External treatments selected was Talam Shirabella with Rasnadi, Chinja Levana Sweda, Labum with the Jadamayadi and Thanyamlam, Kadivasti with the Thanyamlam, soon after performing Chinja Levana Sweda, bandage with the Murivana, right leg, full thigh to plantar region, intermittent skin traction, right 3 kg, and infiltration 30 ml Pipelia denivasana thylam. And on the third, consecutively 5 days, this treatment was continued, and on the third day, Agni Karma was performed. Changes noted. First day itself, the patient slept well without pain. On the third day, she passed motion 2 times. On the 5th day, he can lie in supine position for few seconds, can lie in left lateral position without pain, but unable to lie in lateral position. The 6th day, treatment was changed. Chinja Levana Swedam changed it and Patra Podala Sweda started, and Kadivasti with the Dhanyamlam stopped, and Kadivasti with Dhanyandaram and Sahajaradi Thailam started. Matravasti was also started. And 8th day, the pain was reduced, but more felt during. There was night pain. Night pain and cramps was also there, but more felt during night. DM and BP well controlled. Then 12th day, Matravasti, intermittent traction, bandage, also all these treatments are continuing, and 12th day he can walk. She was able to walk few steps. Then Patrapodala Sweda, local Thailadhara, Matravasti, bandage and skin traction continued. It is written in day by day. The 9th day, pain was slightly elevated. It was a rainy day, and there hot water bag, Levana Sweda, etc. used in night. The 12th day, it was better, able to walk few steps with the support, pain present, but comparatively less. Thalam, Patrabodal Swedam, Thailadhara, stopped Kadivasti and changed into Thailadhara with the Sahajaradi and Thanundaran Thailam, local. Matravasti, bandage and traction was continued. The 16th day, she can walk without support. Then the treatment changed into Shastika Pinda Sweda and stopped Patrapodal Sweda, and Matravasti was continuing, bandage and traction was continuing. 8th day, it was better, can sit for 5 to 10 minutes without support, giddiness was present. 19th day, can walk without support for 6 to 8 minutes, sit for 3-4 times. And for 14/7/23, pain considerably reduced, walk without support for more time, giddiness was present. On the 23rd day, better than previous day, can walk, sit better on examination, muscle tone, muscle bulk improved, anal sphincter tightened. On 26th day, 19/70/23, she was better, pain reduced, can sit, stand more time, mild giddiness was present. On 16th day onwards, Patrapodala Sweda is stopped, Shastika Pinda Sweda was used, Matravasti, bandage and traction was given. On the 23rd, 4 days, Shiravasti, Panjadikta Shiravasti was given. On 23rd day onwards, only Thalam, Aphinga with the Kubja Prasarani Thailam and Shirathuma was giving. Condition at the time of discharge, muscle bulk, muscle tone improved, patient can walk with support and left the hospital by walking. She had a great desire to worship at Perunna Subramania Swami temple nearby. On the day of discharge, she along with her daughter offered prayers before get discharged. Follow-up. After 3 months, she was able to walk and travel out. Comorbidities were well controlled. After 6 months, treatment repeated. Now she is perfectly fine, doing a normal life cycle. Conclusion. These type of cases can be very well managed and can be a miraculous effect through Ayurveda with the simple treatment modalities within a short span of time. Treatment done includes Chinjalavana Swedam, followed by Kadivasti, Patrapodala Swedam, Matravasti, Panjadikta Kshiravasti, Thailadhara, Abhingam, Shastika Pinda Swedam, bandage, Shirathuma, and intermittent traction, and 1 day Agnikarma. That is all. Thank you.
Thank you, madam. So I think takeaway from Dr. Rati ma'am's presentation, we will come back to you, madam. The movement from Chinjalavana Swedam to Patrapodala Swedam to Shastika Pinda Swedam, and how she was assessing when to move from Patrapodala Swedam to Shastikam. Then she mentioned about Marmakiri, Mottakiri. We'll come back to you at the end, madam. And Kativasti with the Dhanyamlam, then Kativasti with the Taila, then Tailadhara. And I think a lady who was 63 female with uncontrolled diabetes, hypertension, depressive in nature with almost bedridden, was able to walk by the end of 26th day. The stage-wise treatment she had mentioned. And I think Kubja Prasarani Thailam Kshiradhumam towards the end. We'll definitely come back to you for details, madam. Thank you so much for the explanation, madam. So now I call upon Dr. Shashikumar sir, who is with more than 3 decades of experience, nearly 40 years of experience in treating, practicing, now in an administrative post at Amrita School of Ayurveda too. Over to you, sir.
Thank you very much. Respected Dr. Ramanathan and the august audience of doctors. So, the spine care is one of the most important areas of Ayurvedic practice. From cervical spine to the coccyx, a single day will not elapse without getting a patient. That is the true nature of the Ayurvedic clinical practice. And I have the experience of treating so many patients. So I will tell you some of the patients, and we will discuss with all the details with it. And now recently, that is 2 weeks back, I had a patient, 70-year-old, a sober-minded gentleman, very much educated. He came to the OPD wheelchair bound, and he cannot even speak well. That is hypophasic due to the severe cervical pain and stiffness. And as far as my clinical practice is concerned, the main thing that when a patient comes, I won't go to the investigative methods that the patient brought to me, because then we will become prejudiced. Then we will be working upon that basis. So first we have to make a concrete idea of what the patient is suffering from by our own clinical examination of the patient. That is the better thing. So this patient while wheelchair bound, that means he is a frail patient. Frailty is the nature. He has a hypophasic, means he has to speak well due to any cause, from a painful mouth to a severe neurological disorder. Maybe we can perceive. Then the next thing it is that to respond to the presenting complaints of the patient. So I had what I call a stiff neck and severe pain on the nape of the neck since the past so many years. And I had been doing with some first one local medicines and when local doctors when the march of symptoms are aggravating. After that, I had undergone treatment at different centers on different lines. When the symptoms get aggravated and become intolerable, I went to a neurologist and an MRI is taken, and it is revealed so many disastrous and dangerous consequences. So you please look at me. Then I told that, Acha, you keep there. First, let me hear you. That's the first thing. Because in clinical practice, I always advise the junior doctors, you hear the patient. He or she is telling the diagnosis. That is the main thing that is the medicine says. So I started writing the presenting complaints, that is a nuchal pain since the past so many years, exacerbation since past 1 month, a stiff neck, and the patient is wheelchair bound, a frail old male. That was the first thing that I had observed in that patient. Then other by assistants or the house surgeons, the junior doctors, very competent doctors, I asked them to see what is the vital data. That's the main thing that you have to do in clinics. First you record the vital data of the patient. A lot of information will be you are getting. Sleep temperature, you need not use a thermometer. The WHO has accepted the evidence-based problem. That is, you feel the temperature with the back of the hand on the forehead. If the forehead temperature is greater than that of the rest of the body, the patient has fever. This is the evidence-based medicine. The WHO even approved it. Very easy. You feel the pulse. You feel the heart rate, heartbeat. Then you feel the BP and the respiratory this rate. That is sufficient. But apart from this, when cervical pain comes, you have to palpate then immediately I palpated the carotid artery. Carotid artery pulsation is very important, especially in old person. Whether there is a carotid bruit is not there. Then whether subclavian pulse is also very important. Carotid pulse is felt in front of the neck, medial to the sternomastoid muscle, below the angle of the chin. That is the position, anatomical position of the carotid pulse. Subclavian pulse is the middle of the clavicle. Over there. So after that, I start examining the cervical spine. So in an old age patient, the cervical spine movement should be made with meticulously done, and it should be done with utmost care. Two things are very important. First, he might have been a previous complication of arthritis or osteoarthrosis years back. Second, he is in a senile period. So there is a chance of, if a violent movement is done, there is a chance of getting the atlantoaxial dislocation, and sometimes the patient may die in front of you. That means especially in making flexion of the cervical spine. So you ask the patient, do it actively first. അച്ഛാ തലേന്ന് കുനിച്ചെന്ന് മാത്രം പറയാം, വേറെ ഒന്നും പറയരുത്. പിടിച്ച് കുനിക്കരുത് ഒരിക്കലും, ഒരു കാരണവശാലും കുനിക്കരുത് തല. സംടൈംസ് അപ്പോൾ പറയും, ഞാൻ ഒരുപാട് പേഷ്യൻ്റ് ആർക്കും പറ്റില്ല, ഒരു പേഷ്യൻറ്റിനെ പറ്റുള്ളൂ ജീവിതത്തിൽ, അത് പിന്നെ പ്രാക്ടീസ് ചെയ്യേണ്ടി വരില്ല, വേറെ കുഴപ്പമൊന്നുമില്ല. ഒറ്റ പേഷ്യൻറ്റിനെ പറ്റുള്ളൂ, ഇതേവരെ ചെയ്തിട്ട് പറ്റിയിട്ടില്ല, ഒരു പേഷ്യൻറ്റിനെ പറ്റുള്ളൂ, പക്ഷെ പിന്നെ പ്രാക്ടീസ് ചെയ്യേണ്ടി വരില്ല ജീവിതത്തിൽ, അതുണ്ടാവുള്ളൂ. അപ്പോൾ നമ്മൾ ചെയ്യുന്നത് ഓരോ ഏതൊരു പേഷ്യൻ്റ് ഇസ് ന്യൂ പേഷ്യൻറ്റ്. വാട്ട് ഐ ഡിഡ് മീൻസ് ആക്റ്റീവ്ലി ചെയ്യാൻ പറ്റും, കുനിക്കാൻ പറ്റില്ല. ബിക്കോസ് ഫ്ലക്ഷൻ ഷുഡ് ബി 80 ഡിഗ്രി, അതാണ് നിയമം. ദ അക്യൂട്ട് ആംഗിൾ ഷുഡ് ബി 80 ഡിഗ്രി. എക്സ്റ്റൻഷൻ it should be 50 degree. From acute angle to obtuse angle, the limit is 130 degree ആണ്. And then lateral, what is flexion? Lateral flexion, it should be at least 45 degrees. Even though some can touch the acromioclavicular joint. And rotation, it should be 90 degree, at least 80 degree should be there. All the movements are highly limited. A very stiff cervical spine. Then another thing it is that I ask him to remove the shirt. What do we see? Alas, supraspinatus, deltoid, even pectoralis muscle, all these muscles are getting, or what is got atrophied, wasting. Another thing, his hand is kept internally rotated, adducted, and the wrist that is flexed in position. Abduction palsy is there. Policeman taking the bribe, poster. A very severe patient, old age. But one of the most landmark it is that he is not diabetic, he is only hypertensive, taking hypertensive medicine, antihypertensive agents. After examination, the main thing it is that all limitations are the cervical, this carotid pulse is there. There is, on auscultation, there is no carotid bruit, and then the upper limb, this circulatory deficiency as well as neurological deficiency should be examined. Distal pulsation should be examined. Another thing, we have to see the capillary filling. If microcirculation is, you press the nail and allow the nail to branch. Immediately release it. The capillary filling should be less than 1 second at time. You press the gland and you release it, 1 second is the time. If 3 seconds more than 1 second, the patient has a microcirculatory deficiency. Then you see the thenar and hypothenar eminences. Atrophy of hypothenar eminences, C6, C7, C7 level this affected. Then you see the lumbricals. Then you use to enter the grip strength. Very easy. It is can be done in within minutes. Grip strength is usually done. You see, you never ask the patient to catch your hand. That is an unscientific way. You introduce only thumb and the middle finger from the thumb side of the patient. This is the norm, internationally accepted way. If but is a modern medicine, see people happen to see you are seeing in an unscientific way, they will laugh at you. That is why they are laughing at us. The international way is you introduce your middle and the index finger from the thumb side of the patient and ask to catch. This is the international way or the accepted way by neurologist or this rheumatologist to this thing. And not accepted is in the modern medical trust like this. That should be done. And you see the reflexes, biceps, triceps, and supinator reflexes. All are diminished, I think. Then you see whether the patient is having any other problem for what is called this aphasia or hypophasia. whether there is a swallowing defect. You ask the patient. So swallowing defect should be asked in such a way that all the paraphernalia or the details should be collected. Swallowing defect, the patient may, can you swallow food? Okay, I can swallow, sir. Can you swallow? I can liquid. Honey. You clarify it with bystanders or caretakers. Whether the patient is keeping food for prolonged time in the mouth. That is an early prodromal stage of dysphagia. This patient is developing dysphagia. In such patients, the problem that is, when you are doing with what is called the further treatment with nausea, etc., you should be very careful. Because the patient is developing a swallowing defect, you do nausea, it will be aspirated. Patient may develop aspiration pneumonia. So this is a pointer. Because the patient is slowly developing, but this patient doesn't have that problem. No, nothing else. I clarified with bystanders or caretakers whether he has any that problem, nothing else. This there. And any other cranial nerve deficit it is there. Gag reflex you can see. But gag reflex is a reliable reflex, but it is only seen in advanced cases. You take a very thin, what is called this towel or any other paper, ask the patient to put out the tongue, you introduce it and fossa. Then the patient will, if it is not the patient is not, gag reflex is not good, the patient is having vagal paralysis. Because two important muscles, stylopharyngeus and cricopharyngeal muscles, are supplied by this vagus nerve for controlling the glottis. The glottis is going to be paralyzed in this patient. There will be problem will be there. So all these cranial nerve tests has been done, and then finally I asked him that he has got multiple level disc prolapse with what is called cervical myelopathy. Another thing it is that never leave the patient without examining and lower limb. Because the cervical cord contains craniosacral outflow. So the problem will be suppressed in the lower limb also will be there. Great difficulty, strides of walking, face of walking, tandem walking, all these things should be tested. Then everything be tested, that is satisfactory, there is no problem with the patient. Patient is only hypertensive, all these things are. And always do a para-abdominal examination, 2D abdominal pathologies. Very important. The patient may conceal that whether he is alcoholic or any other problems, he will not tell you. And then if it is there, you are suspecting that thing, you can go for the cage questionnaire. Cut down, annoyed, guilty and ever. That is called that is well approved cage questionnaire. You can all these things will be recorded and you do all these analysis. Then you came to know that the patient is having multiple level disc prolapse from C2, C3 to C1, C2 to all the levels. Because the nerve neuroplasty is there, muscle atrophy is there, the patient hypophasia is there, all these problems are there with this patient. Then you look at then only I looked at the MRI. Same thing it was written. Myelomalacia, advanced disc. This thing that I had not seen clinically means disc osteophytes pressing the spinal cord, spike cord. That we cannot see because disc osteophyte we cannot see by examination. But otherwise clinical examination was perfect. Then you will be getting more confident because what you have done clinically is the same you are getting in the imagology. First you are seeing the imagology, what happens, you will be prejudiced. Other thing it is that the MRI might have taken 2 years back. Much water had flowed under the bridge then only the patient coming to after treating elsewhere and anywhere in different lines. So you have to assess the present status of the patient. So that is the thing. Then we started the treatment. Patient was admitted and firstly we gave Ubanaham. Ubanaham, it is the cervical Ubanaha, that is the thing we have given. Nagaradi Churna with the classical Ubanaha. That is Ubanaha, and Ubanaha Churna is also available nowadays. Ubanaho Vajagurna Sadahwa Devadarupi. Rasnaiganda Samasteja, Rasteranda Jadapshay, Utrikta Lebane, Sneha Sukta Takarpaya Plude. Here the more thing is that you will be sometimes getting the kidnum, it is very difficult to get. Because you cannot get the residue of the arista active or on Villan Vimsi at the time you want it. Next thing that we are doing, that a moderation that we are doing, we are getting arista because it contains an alcohol. Other things are acid. So acid and alcohol in that contains are in this ingredient are acting together making ester. Esters are very highly less side effects and more absorbing nature. That is why Acharyas have put for this Upanaha for such conditions. Upanaha is highly effective and practice it with mild cervical traction of 1.5 kilograms. And then we started what is called, after 2 or 3 days, the Kashaya was given. First is Ashtavargan Kashayam, Bettumaran Guliga, Dhanundaran Guliga, Trayodashanga Gulgulu, Stifine tablet, and I think pledge it. Then after that, 2 or 3 days, we started Pratimarsanasya with Anuvayila. Whether he can do anything, he can combat with it. He best complaints was noted. And then he was given sent to the physiotherapy unit where the pain modalities were done. Because in Ayurveda, Amrita Ayurveda, there is a well-fledged physiotherapy unit is there. And physiotherapist would have a neurophysio, cardiophysio. He is a very talented physiotherapist. He started pain maneuver physio. And after that, then he slightly some improvement was there, and after that he was given an Snehapana with Gugulutagrata, Jetrurda Sarvagada Gulma Gudottamehan. And it was this since it was this Krishna Krudu, night Snehapana is permissible. So considering that is that days can be reduced, hospital days can be considerably, and night Snehapana is also permissible in Grishma Kritu. He was given what is Snehabana in the evening. Usually we will give food at the time of 5 to 6 o'clock and given a rest period of 1 to 2 hours. Then the Snehabana will be given. And another thing it is that this Jetru the Gada. So then Snehabana given for 5 to 7 days, and it was given. Then he was given a gentle Abhyanga, and then given Birejana for 1 day, and Marsanasya was given. For that one, Al-Guguluta Krita continued as a Shamana Snehavana also, the condition. And the Kashaya was changed to Prasaranya the Kashaya. Prasarani Masha Bela Rasona Rasna Mahaushade Pragodidam Dedamba Pibandiye Chiribujo Jayanti. This is very critical. Because you see very important point. Prasaranya the Kashaya, the Anupana, or it should be mixed with the Chira. Because if this vehicle formation is not followed, that is, it should contain milk solids for better absorption, for penetration. So how we are giving means Prasarana Shira Kashaya sometimes practically we cannot practice in our clinic. The problem it is that we got to make a Shira Kashaya every day in the clinic. What I am doing is I will take 15 ml of Prasarana Kashaya, 30 ml of Shira, and 60 to 100 ml of water and boil it and then keep it cool and give to the patient. That is the best thing, but better absorption we are doing. Sarana Dhanandaran Guliya, Maharaja Prasarani Taila, and Chirabela also was given because Rasayanam Mukhyatamam Indriyanam Prasanam Jeevanam Brahmanam Sodyam Shuklasrit Doshanasana. Because the Sora problem it is there, the Rasayana also because the Adushaya is there. Degenerative process, but both it will be benefiting. And when doing Marsanasya, what they are doing means the post-Nasya procedure was done very carefully. Dattedu Padadala Skanda Hasta Harnadi Mardayed. Because that should not be done in this patient, because a violent movement of the cervical spine will result in serious complications. So that is one with only with very little what is called this severity, but is in a moderation. But Dhumavana and other was given. Another thing we have to observe during Nasya is the patient is having other dysphagia rather than in an old patient is whether he is using artificial dentures or not. Because you remove the artificial dentures, otherwise during Nasya process it will lose and go to the throat, it will go to asphyxial death. So you have to see what is the patient is having any problems with one another. Another thing you have to problem in Nasya is that the Nasya is then Snigdasinna Uttamangasya Prakrutavashagasya. This is not Prakrutavashagasya Roganaha Snigdasinna Uttamangasya. So the patient should have had a urine and stool pass normally. So when you do practice it, you have to do in the penultimate day. In the morning, can you ask, you simply don't ask the patient whether you are going to attend the washroom or the restroom. No, that is the problem. Ayurveda has given, there is a prakrita avashyakasya. So usually what I am doing it, I will give him either 15 ml of this 10 to 15 ml of Erandadaila, because Erandadaila is very good for the spine disorders. So Tiktoshnam, Erandadaila, Swada Saran Guru, like Vardhava Gulma and Regaram, Vada Anilanashanam, and Duksho Kadi Guhya Kosta Prashtasa. It is good anti-inflammatory. It has good spine health also. Even in minimal quantities, you can give. In so many patients, lumbar patients, that I am practicing it 10 to 15 ml of Erandadaila. Now, capsule is available, and I am not going to any other influence. This sapsciatin capsule is very good for after treatment. Because the Erandadaila, Asta Saptanga Shaya, and another thing it is Aratanga. Two capsules, do BD for 2 months you take, and you take physiotherapy, etc. That in lumbar spine, usually I am doing it. And NS they are taking what is called sapsciatin amrita also. So in such conditions, you see, when Nasya you are doing one thing, and 7 times Nasya, and Nasyante Vakshadam Tishte, that is very important. Nasya procedure, remain the patient at least for 1 minute. Dhumam Pita, Dhuma you should, because Nasya should be given, Dhuma should be given after Nasya, because when you are taking deep inhalation, what is the problem? It is that the cranial, what is called this blood collection, this venous, the blood will be collected more in the cranial venous sinuses. So due to the rise in intrathoracic pressure. So that will give me a relative hypoxia. That is why you are giving what is called this dhuma. Dhuma means you are giving carbon dioxide. Carbon dioxide is the best respiratory stimulant. Immediately it will be giving the medullary stimulation, and the patient may start breathing, and the hypoxia will be overdone. And you kavoshnabu kavalam kandasudhi, because very important. Otherwise, nasya particles will be sticking upon the pharynx and other areas. It will be creating other infection to the patient. So all these things will be performed for the, and the patient was discharged after 20 days with the precision of Gukuluta Krida, Prasaranyadi Kashaya, and sapsciatin capsule. That is the whole thing. Okay, thank you.
Thank you.
For
Thank
giving
you,
an
sir.
opportunity to present the picture.
Thank you, sir. I think you have given relevance of clinical examination, then moving from Ashtavargam Kashayam with Vettumaran to Prasaranyadi Kashayam with Shirabala, Snehapanam with Guguludikta Gridam. That to Shodhananga Snehapanam you had mentioned during night period. We'll come to it at the back, at the end, sir. So may I next call upon Triveni Suresh, sir, who is a well-known Marma practitioner as well as professor and head department of Shalya Tantram, Pankaj Kasturi, for his address, sir, please.
Good afternoon. You are all feeling very hungry. Okay. My most respected, my elder brother, Dr. Sitaram, sir. And Shashikumar sir, also I call him brother, Anna only. We are classmates, Dr. Redibi Unithan and also Dr. Jayan, we are classmates, and Sham is my junior. I don't know what to talk, because spine, every day I get not less than 40 to 45 patients spine alone. And all of a sudden, to take one case and present you is something very difficult. But what happened recently was, I was taking a class. One of my students came and told, "Sir, I am having neck pain." Then I told, "Do you have taken an X-ray?" "Yes, I have taken X-ray." Then what did they say? "Sir, it is cervical spondylosis." Then I told, can I see that X-ray? Then I found an X-ray which you might have thinking that it's cervical dip. Have you heard about cervical dip? Anybody? Yeah, cervical dip is, see, in your classmates, somebody might be having one finger like this extra, a growth like that. Like that, you all know there are C to C7 vertebra. And T1 onwards, rib starts. For some reason, if one rib starts from C7 vertebra, what happens? there will be congestions over there. How will you identify that? See, you can take an X-ray, but the symptom usually it is seen in ladies. 50% are bilateral. There are 3 types of cervical rib. It can be a rudimentary rib, it can be a complete rib, or a cord-like structure. It can be a total cord also. You know, as Shashi sir used to say, we used to sit on all Saturdays in our room and start reading Das, etc. Madhuri was telling recently, just now also. That is how we started, or we got so much knowledge, because it is Acharya Padamate, Padam Adate. Then with surroundings we gain lot of, and whatever knowledge I gain is all through talking to these genius people sitting here. And I tell you, there is a triangle in the neck. There are 3 types, 3 triangles, anterior, posterior. There's another triangle called scalene triangle. A scalene muscle is a V-shaped muscle. From there, all the arteries, veins and nerves comes in between. For some reason, if there is another thing compressing the 2 convoas, what happens? The circulation towards this will be lost. And the patient complain there will be what's known as wasting of the thenar, wasting of the peroneal. Is it clear? Yeah. So how will you identify by taking an X-ray? In X-ray, you don't know whether which is C7, which is T1. See, I'll tell you one simple example. See, all the transverse process of the cervical vertebra looks downward. All other transverse process look upward. So there is only one transverse process literally touches each other. That is C7 and T1. Is it clear? See, you take an X-ray, AP view, all the transverse process of all other vertebrae is looking downward in C7. But T1 onwards, it starts looking upward. So there is only one area where these 2 transverse process touches each other. If a rib starts from there, that is known as cervical rib. And the symptoms are, there will be wasting, there is kazhappananu paraya, pain and swelling won't be there. There will be a dull ache, and there will be wasting of the muscles. And what is the test? Something called Adson's test. That is how it has been done. You turn usually it's bilateral. So you turn the head towards the affected area and start seeing the pulse. You note the thrill of the pulse and start gradually lifting the hand, and a stage will come, the pulse gradually comes down. This is known as Adson's test, and you will be able to identify. So what Ayurveda can do for this? It is a surgical thing. But I tell you, every month, not less than 5 to 6 cervical students are here. They might have seen so many cases of cervical rib. It can be either a rudimentary rib or a complete rib or totally. If it is complete rib, we won't be able to do much. But for rudimentary rib, etc., we can make the pain comes down. All the symptoms can be brought back to normal. What are you going to do? As Shashi sir has told, we have to give Patravalaseda, Nasya, and all this will give you lot of relief. And don't ask me the rationale, but the patient is improving with proper Ayurvedic treatment. This is the one case which I have a lot more to talk about this, because there can be different types of claudications. It can be either vascular or neurological. This is not the area to talk. And another case which came to me was a patient who went for that Kumbh Mela, and he got so excited and jumped into the water, and he got his C7, C4, C5, C6 totally damaged. He was taken to Apollo Hospital there, and then to Delhi, and later on came to Kim's Hospital, and he was there for 3-4 weeks. And he came in a wheelchair to our hospital and see if there is a fracture, if it is not surgery is done, we can assess and we can take the patient accordingly, because it's mostly a wet compression fracture. And you see, you take the length of both anterior and posterior body of the vertebra. If it is less than, say, 50% is not compressed, then we will be able to take, it is stable. And what we do is, we just put a collar and give a small traction, and then as he has told, no movement is given. And we give a LEPA, and inside we give Marmasutra Arishtam, Magaradhwaja Arishtam, are the two drugs which we use for all trauma related. Because why I talking about trauma? Because all others will be talking about the other things. And then we started giving a small, what's known as internal medicine like Dasathaila, Gandhathaila, etc. And gradually the patient start recovering. And then we have a good physiotherapy center where all the physiotherapy has been administered. And 3 days before, in our group, where we call it as Sheena's group, I have posted that patient is able to walk. So like that, lot of trauma-related spine work we are doing, and we will be able to help them. I think not less than 2 to 3 per month on trauma we get it, and we are getting good results. Why I am talking to you? Because you should also, this is not my what's an this thing. You, if I can do it, you should also be able to do it. This is what I always tell my students. Please, you are always welcome to our hospital. You can see the work which you are doing, and you will be inspired, and you can also do it at home. Thank you.
Thank you, sir, for that loving, inclusive words. Marmasutra Arishtam, Magaradhwaja Arishtam, I think are not very common to others. We'll come back to you. And sir has explained about cervical rib and the possibilities that we have and traumatic cases. So thank you so much, sir. Next, I would call upon Dr. Jayan, sir, retired Joint Director as ISM Department, Chief Consultant Physician at Madhaviyam Hospital, to come up with his experience. Sir, please.
Good afternoon, one and all. Few words about the Sitaram. Sir, on 1986, I started my practice using Sitaram Ayurvedic medicine while doing my PG first year in Kollu. At that time, Dudra Varya, and I don't know whether he is working is there or not. The first person contacted me. I started my journey with Sitaram. I'm so happy to see all these things. That means Sitaram is giving much importance to the education and sharing knowledge to the youngsters also. So also distributing good medicines also. See, according to Ayurveda, the Pada Chadishtaya, Fishak Dravyani Upastada Rogi Pata Padishtayam, the importance of Dravya, Bahugalpam, Bahugunam, Sambannam, Yogyam Aushadam. ഞങ്ങളൊക്കെ പ്രാക്ടീസ് തുടങ്ങിയിരിക്കുന്ന സമയത്ത് നല്ല പാചകക്കാരും കൂടെയായിരുന്നു. കാരണം നല്ല ഔഷധങ്ങൾ, നല്ല ഏജൻസിയൊക്കെ കിട്ടാൻ വലിയ പാടാണ്. മനസ്സിലായില്ലേ? അതുകൊണ്ട് നമ്മൾ കഷായമൊക്കെ ഉണ്ടാക്കി കൊടുക്കണം. ദാറ്റ്സ് എ ഒള്ളി ഡിപ്പെൻഡൻ്റ് ഇതിനൊക്കെ ഉള്ള നല്ല ക്വാളിറ്റി ഉള്ള മെഡിസിൻസ് അല്ല നമ്മൾ യൂസ് ചെയ്തെങ്കിൽ നമുക്ക് ഈ സിസ്റ്റത്തോടുള്ള ഫെയ്ത്ത് പോവും, തുടക്കക്കാർക്ക്. ദാറ്റ് ഈസ് എ ഫ്യൂ വേർഡ്സ് അബൌട്ട് ദി Sitaram. Before sharing the clinical experiences, a few words about the clinical evaluation of the spine. Sorry. So, while examining a patient, Acharya says,
Darshana Sparshana Prashnayiki Parisheda Roganam. What is the importance of history? If you take thorough history from a patient, you have to open your ears to hear what the patient is saying. The patient itself may say the diagnosis. First, you have to take a thorough history of the patient. That is the importance of history. Darshana, prashana means palpation. The test, clinical tests we are doing takes to make a clinical diagnosis. Sparshana. Then darshanam, inspection. We have to observe the patient. Before touching the patient, we have to observe the patients as a whole. So, what is the importance of history? Well, considering the spine cases, always patient presents pain, isn't it? So, we have to think about the onset of the pain, whether it is an insidious one or a sudden onset. The sudden onset of pain we can observe in IVDPs and some infections like that. The insidious onset pain we can observe in degenerative diseases. While the patient stooping forward and lifting an object, sudden onset of jerky pain, the patient will say, so while bending forward, I feel a jerky feel or catchy feel like that. That is the onset of pain. If it is a sudden or insidious pain. Insidious means it will take sometimes months, weeks, like that. These insidious pains will take, we can observe that, you can see in degenerative diseases. So, while considering the spine, two areas we have to consider, column lesions and cord lesions. Column lesions means the structures that affecting the spine, that means in the vertebra, in the vertebral disc, facet joints and the central canal, and so also the lateral canal, neural canal, central canal and lateral canal. So the structures affecting the column and the cord. Cord means affecting the spinal cord. So the importance of pain, is it an insidious one or it is a gradual one? Then the time of pain. Some patient says that while he wakes up from the bed, the pain is aggravating. Or while he walks for a time or up to 10 a.m., the pain comes down. That you have to note. Why? Sometimes the patient says while he takes rest, the pain goes. While start to move, pain aggravate. Why? So, the rest pain we can observe in ankylosing spondylitis. So also some infectious diseases. Some inflammatory conditions, you can observe that the pain, while takes the pain, rest time, the pain aggravates. So also some degenerative conditions also, the movements of the spine also we have to think in later. So the time of pain, whether it is a rest pain or a mechanical pain. While the patient moves, the pain aggravates. That may be the degeneration of the facet joints. So while the patient moves, the pain comes down. That may be due to some ankylosing spondylitis like that. So time of pain. Then comes the site of pain. Where it is, whether it is in the cervical region or thoracic region or at the lumbar region, the site of the pain. So, the patient sometimes complains that the pain at the cervical region and it is radiating to the upper limb. Upper limb means, then upper limb on the lateral aspect of the forearm, sometimes the patient says on the medial aspect of the forearm. If the pain is on the radial aspect of the pain, radial aspect of the forearm, we have to suspect the lesion at the level of C4, C5, C5, C6 and C6, C7, affecting C5, C6 and C7 nerve roots. If the pain is on the medial aspect of the forearm, radial aspect and the medial aspect of the forearm, we have to suspect the lesion at the level of T1. C7, T1. So the site of pain. Sometimes the patients presents pain to his thoracic region, just like the band. എന്തോ കെട്ടി വെച്ചിരിക്കുന്നത് പോലെ ഒരു വേദന വരുന്നു. So we have to suspect the degenerative changes at the level of the thoracic level. Site of pain. First is onset of pain, then site of pain, time of pain. Sometimes patient presents pain at the lower lumbar level and it is radiating to both lower limbs. Posterior laterally, the history will be like that. That is the importance of history. First we have to think about the pain. So also we have to consider the age of the patient. Most of the IVDP cases we can see at the age of 30 to 40. Degenerative means that old age stages we can see. So also, while the patient, sometimes the patient says the pain aggravate while bending forward. Sometimes the patient says that the pains reduces flexion movement. Extension. Sometimes the pain aggravates during flexion and sometimes the pain aggravates during extension. In lumbar canal stenosis, while the patient bends forward, the pain subsides. Lumbar canal stenosis. So, while the patient moves backwards, that means extension pain increases in lumbar canal. Why pain decreases by moving forward? So, the lumbar canal diameter will increase while moving forward movement. So, the radiating pain also we have to move. So, also the movements, aggravating factors. Sometimes the patient says that while the cough and the sneezing aggravates the pain. That may be IVDP because Valsalva test. Then also the inspection, we have to observe the patient from front, back and side. In front, what are the things we have to look for? Whether the abdominal protuberance is there. In acute IVDP, we can see the lumbar lordosis is increased. Abdominal. So sideways, we can observe the scoliosis. On front back, we can look for if there is any angle deformity. If one vertebrae is fractured at the level of the thoracic level, we can see that there is an angle deformity, knuckle form deformity, only one angle. If the fracture in osteoporosis, 4 vertebrae fractures, we can see a round back deformity, round back deformity at the level of the thoracic level. So after having a thorough history and inspection, we have to do the Darshana, Sparshana, Prashana. At the next, we have to do some clinical test. So what is the test we are doing for finding is there any cervical radiculopathy in a case of a cervical radiculopathy? We have to do one test is pulling test. Ask the patient to sit on a stool or chair. You gently turn the neck to one side, head to one side, and extend the chin and give a pressure to the occipital region so that the pain will radiate to the upper limb. That test is called pulling test. Ask the patient to sit on a chair or a stool and bend sideways, then extend the neck, give a downward pressure into the occipital region so that the patient experiences pain into the upper limb. That test is called as pulling test. So if the pain is on the medial aspect of the upper limb, it may be affected C7 and D1 nerve root. If on the radial aspect, C5, C6, C7. That also you have to observe while doing this test. That is about this cervical disc issue and root compression test. So if it is a myelopathy case, you ask the patient to sit on a chair and gently flex the neck so that the patient experiences pain throughout the spine. That test is called very simple test. That is myelopathy case, the patient experience throughout this pain. Otherwise called, നമ്മളൊരു ബാർബർ ഷോപ്പിലൊക്കെ ചെല്ലുമ്പം മുടി വെട്ടാനായിട്ട് ഇങ്ങനെ ഇരിക്കത്തില്ലേ? This is the position. At that time, the pain aggravates. So So also sometimes what Dr. Suresh said about the cervical rib, where the Addison test is also we can do. Very simple other test which is called a roots test. Ask the patient to abduct the shoulder 90 degree, the elbow also 90 degree, keep it for a while and ask to flex and extend and flex the fingers for 3 to 5 times, so that the patient experience, the radial pulse will be diminished, so all the patient experience numbness and tingling sensation. So in cervical cases, we have to first roll out this cervical rib also. Patient presents pain to the cervical region, radiating numbness and tingling sensation. So also we have to, so that we can roll out the Raynaud syndrome also. So at the level of the thoracic level, the test what we are doing is called roots test. But, ask the patient to lay down on a table and gently bend forward and observe the abdominal muscles at the level of the umbilical, whether it is coming up or coming downwards like that. That test is called the roots test. So many tests you can, at the level of the lumbar level, SLRT test. Ask the patient to lay down on a table and gently ask the patient to raise his leg upwards and observe at what level the pain is coming. So also the Lasago test, along with that you can generally do the dorsiflex the foot, so that the patient experiences much pain posterior laterally, affecting L4 and L5. Another one is contralateral SLRT. Keeping the affected side, if the patient is seeing pain on the right side, you ask the patient to lift the left side. While the patient experiences pain on the affected side, that is what is called the contralateral SLRT. So also we have to roll out whether it is an IVDP or affecting the SI joint. The same way the patient will experience pain, back pain. So in that case, we can do the compression test, pressing the anterior superior iliac spine, so that the patient experiences the pain at the SI joint. Another test is called Jelenset test. Ask the patient to lay down on the table and flex the unaffected side, flex the lower limb, that means flex the knee and the hip joint of the unaffected side and put the affected side on the side of the table, so that the patient experiences pain at the SI joint. So, which nerve roots affecting the lower limb? Very simple. If the S1 nerve root is affected, the patient experiences pain in the upper part of the thigh, L1, just below L2, L3, L4 at the level of knee, L5 here, and S1. That's the way, the lower limb. L1, L2, L3, L4, L5 and S1, like that. So these are the common tests we are doing to make a diagnosis. First we have to take a thorough history and what are the things patient saying, that you have to observe and you have to note it down. Then we have to do the inspection for the scoliosis, kyphosis, like that you have to do. So also very important thing, you have to palpate the spine also using your thumb. The whole spine you have to do a palpation, whether there is a firm feeling or tenderness at the level of the cervical or dorsal spine or the lumbar spine. So now I am presenting 5 cases. You have to make the diagnosis. I will give only complaints only. You have to make the diagnosis. One case, we have a rare case, I shall say. A 62-year-old male patient which I have treated, Trivandrum, presented with coronary paralysis due to RTA, first treated in 2 private hospitals, diagnosed as fracture C4, C5, C6 with post-traumatic injury. With the atlantoaxial instability, patient catheterized, bowel control is present. History of type 2 diabetes, history of lumbar disc degenerative disease also there. On examination, he has assisted gait. With help, he can walk. Muscle power, right grade 3. How will you assess muscle power of a patient? Grade 0 means there is no movement. Grade 1 means only flickering movements. Only flickering. He can just move his muscles. He can also. Grade 1. Grade 2 means if the gravity is eliminated, he can move. Grade 2. Grade 3 means against the gravity, the patient can lift the upper limb or lower limb. If you are give a resistance, the patient can't. Grade 4 means if a mild resistance you can give, he will be able to lift. Grade 6 means full power. So, the muscle power grade 3 on right side and left side it is grade 4. Reflexes sluggish, right upper limb, reflexes sluggish, right upper limb and lower limb. So DTR what we are looking for, knee jerk, ankle jerk, bicep jerk and tricep jerk. In cervical region we have to look for the shoulder also. If the accessory nerve is affected, the patient can't raise the shoulder. Shoulder surging exercise is being very difficult. So MRI revealed cervical asymmetry to right side, cervical canal stenosis C4 to C5, C6, posterior central disc bulge at C3, C4, C5 level, compressing the cord, minimal retrolithosis at L4, L5. While doing the Hermitage test, it is positive. What is your diagnosis? That means turning the neck to one side, mildly you have to do because it's an injury case, and ask the patient to turn to one side and giving a mild pressure to this area. The pain aggravated. That is pulling test, sorry. Hermitage test is just like that of a bar test there. Pain aggravates. It's a case of traumatic myelopathy. The nerve injury can be divided into 3 grades: neuropraxia, axonotmesis and neurotomesis. Cord injury. I already discussed 2 lesions are there, colon lesions and cord lesions. This is a cord lesion, not colon, not structure, not cord lesion is all there, fracture is there. So, nerve injuries can be divided into 3 grades: neuropraxia, axonotmesis and neurotomesis. Just to recall the anatomy of a nerve. There's a nucleus, then axon and dendrites. So neuropraxia means only a contusion. Full recovery you will get, even though there is patient presents with neurological deficit. In neuropraxia cases, full recovery we can expect. Axonotmesis also will recover, but it will take time. In such cases, patient presents burning sensation, dagadiva iva vedha. Axonotmesis is also, you can expect full recovery. But it is a neurotomesis, complete neurological deficit will be there. The recovery chance is being very poor. So this case, I got full recovery. So what are the drugs I have used is Shundi Beladi Shirapaka, Kurundoti Ana Kurundoti Chukka. So correlations. Preferably I am using Indaganda Grida as Snehabana. Good myelination you can expect. Dashamulam, Shatpalam, Aviltuli Devataram. Indaganda Grida. So, in such type of cases, the neuroprotective drugs we have to give internally. Solve the external procedures in order to strengthen the muscles. Abhyanga, marma massages we can give. So, two-way approach in order to strengthen the muscles and the internal medicines to regenerate and myelate the myelination helping medicines we have to give. Good Ayurvedic medicines are there compared to allopathic. So this case almost a complete success I got. So muscle strengthening, Shashtika, Pindasveda, Shiravasti, also Shiradhara, such things. So I all given externally procedures. Another interesting case from Kollam, he was 54-year-old manual labor from Kollam, presented with motor weakness, progressive motor weakness to both lower limbs. Progressive motor weakness to both lower limbs. history of LB, history of claudicating pain. What is claudicating pain? Neurogenic claudication. If the patient walks for a while, the pain aggravates. While he takes rest, it goes off. Again, he starts to walk, the pain aggravates. And while takes rest, the pain goes off. That is what is called a neurogenic claudication. Otherwise, he can say it as a cardiac symptom. It is due to the lumbar canal stenosis leading to myelopathy. That is why this progressive weakness of the reflex signs are present. Usually, if the patient having reflex sign, I reluctant to take. If the patient's bladder control goes within 48 hours, you have to send the patient to the higher center. Bladder and bowel call പോയി കഴിഞ്ഞു കഴിഞ്ഞാൽ ഞാൻ ആ കേസ് എടുക്കാറില്ല. 48 മണിക്കൂറിനകത്ത് നമ്മളത് സർജറി ചെയ്ത് റിക്കവറി ചെയ്യാനുള്ള ഹയർ സെന്ററിലോട്ട് പറഞ്ഞു വിടും. ഇല്ലെങ്കിൽ പെർമനന്റ്ലി ചിലപ്പം ബ്ലാഡർ കൺട്രോൾ ഇതും പോകും. ബട്ട് ഇൻ ദിസ് കേസ് ദ പേഷ്യന്റ് വാസ് റിലക്ടന്റ് ടു ഡു ദി സർജറി. Once he has taken the epidural and he has started treatment, he also got good result. This is a cord lesion, myelopathic case. At the time of the treatment, the muscle power grade was 3 bilateral lower limb. The MRI shows L3, L4, L4, L5 and L5, S1 with remarkable lumbar canal stenosis with a neurogenic claudication. The another case is very rare case, which is called Hirameya. Hirameya means this is an IT professional of 20 years old, complains of weakness and wasting of bilateral upper limb, forearm and hand muscle weakening. First he was consulted at Srijitra Medical Center, where they have suspected this case as a MND, and they have taken the MRI. Anyhow, they have go to Vellore, where they have diagnosed this case as Hirameya. The first it was detected in Japan. It is a very rare condition where the dura mater of the spinal cord is bulging and compressing the spinal cord at the lower level, producing the circulation hindrance. At 4 to 5 years, there will be means progressively increasing muscle wasting and weakness to the forearm. And that's the first case I have met recently. The first time he got such result, the second course treatment is now going on in our hospital. He is improving. That cord is called, this is a cord lesion. Hirameya. The MRI revealed thinning of the spinal cord at the level of C4, C5 and C6, C7. So now I am stopping the presentation. Few words about the marma. So considering the marma and the spine, Acharya says Kugandara. Tatra Prashtamsha Veda Kugundaro Nama Sparsajnana Adakaya Chestal. Both sensory and motor deficit is there. Stronigandu Ruberi Parsandra Pradivande Asya Aschadano Kadigatarane. Tadakaya Shosho Dorbalyasta. Adakaya Shosho Dorbalya. Motor deficit is there. പൃഷ്ടോരുപരി പൃഷ്ടവംശം ഉപയോഗ തൃകസംബന്ധേ അംശബലവോ നാമ തശ്ച ബാഹുവോക സ്വാപശോഷോ. കൈക്ക് പെരുപ്പും തരിപ്പും വരുന്നു. ഇത് ബ്യൂട്ടിഫുൾ ആയിട്ട് ആചാര്യം പറഞ്ഞിരിക്കുന്നല്ലേ. ബാഹുമൂർത്ത ഗിരിവാമധ്യ അംശബലകോ അംശവും നാമ തസ്ത സ്തബ്ധ ബാഹുത. കൈ അനക്കാൻ പറ്റാതെ വരുന്നു. പാഷ്ണിം പ്രതി ജംഗാമധ്യ ഇന്ദ്രവസ്ഥ പ്രത്യംഗുലീനാം യാം കണ്ടരാം അതിരാധ പ്രത്യുക്ഷവം ഗ്രഹണാതി ഗ്രഹത്തിൻ. ഇത്രയും references we'll get. The treatments also. So considering the treatment concept, what is my method of treatment is, so the vitiated vata dosha will produce Vishamagni. Am I right? Vishamagni will lead to Amatva. The first line of treatment in such cases is to specify the Ama. The next line of treatment is for the Vada. For that purpose, we are giving Snehana, Swedana and Shodana. So according to the conditions of the patient, Dushan, Desham, Belam, Kalam, Analam, Prakritam. We have the right to select the medicine. So this is the concept what I am following. Thank you one and all.
Thank you, sir. Thank you so much for the expression of cases and the importance of clinical examination. You had introduced the utilization of Indukantam Gradam, Shunti Baladi Shirapagam with Shunti Bala Atibala. And we would definitely like to hear how did you deal with Hiramaya disease later. So next I would call upon Dr. Shamakrishnan sir for his presentation. Dr. Shamakrishnan, who is always an advocate of rational practice, cost-effective practice of Ayurveda, and an advocate of varied utility of Vasti in clinical practice, even at the level of OP. You need not always think of, and I think he is the person who had discussed most about Vaitarna Vasti at different spaces. And I'm happy to share that I think we have Shashi Kumar sir, and I had discussed with the Shashi Kumar sir that how he was the first person during the late 80s to discuss first time Vaitarna Vasti in Thiruvananthapuram Ayurveda College under the guideship of Shankaran Kuti sir. And he had communicated how they had actually once saw this Vangasena's reference of Vaitarna Vasti. How is it possible? Will it be feasible at all? And he was actually thinking of irrationalizing this combination. Then Shankaranguti sir encouraged him, you try and see, and they tried it in 10 to 12 patients. And I think now when we are practicing Vaitarna Vasti throughout Kerala in different spaces, not only all over India, I think there was a day when it started its advocacy from Thiruvananthapuram Ayurveda College, and remembering all, I think, Vaidyas like Panavalli Krishnan Vaidyer, etc., who was advocated the book called Vasti Pradipam, wherein which describes different practicality of Vasti when Kerala was actually known for its special treatment modalities like Ayasekam, Shirodhara, etc. And we were not much into Vasti Prayoga, but I think Vaidyas who had been trained under Srinarayana Guru, Manakkodan Kesham Vaidyer, they had a tradition of practicing Vasti, especially in this part of Kerala. So again, when Shamakrishnan sir on board, sir, over to you for your session.
Vande Guru Parampara. My pranams to one and all, respected panelists and dear doctors. So I will assure you that I will finish within 15 minutes. So this presentation does not aim to dictate specific medicines for vertebral disease management. Instead, it emphasizes a deeper understanding of the disease progression and the guiding principles of its treatment. The focus should be on strategic approaches rather than merely replicating prescriptions. The real challenge is not a lack of familiarity with Ayurveda medicines or therapies, but rather a gap in comprehending its core principles and applying it effectively at different disease stages. So let me introduce for a patient with a degenerative disease, the first option may be modern medicine. That is conventional modern therapy, because they diagnose it very precisely and give faster relief. So it may be effective in many patients, but for those patients who fail to respond to conventional therapy and cannot afford modern medicine, we have conventional Ayurveda therapy, may be effective in many, we have seen that. But for those patients who fail to respond and cannot afford our Ayurveda treatments, and also for doctors who are not satisfied with the conventional approach, we have another option. That is, don't we need an approach which is safe, which is effective, cost effective, fast acting, low recurrence, and scientific, in the Ayurvedic sense, scientific. We call it as unconventional Ayurveda. So why even though we claim as getting good results, when we review the results are not satisfactory due to temporary relief of symptoms, recurrence, long-term treatment, cost of treatment, and poor quality of life. So we need to analyze all these things. So there is enough evidence to show that it is not working in all patients. So we need to review the conventional unscientific practices in Ayurveda. So what is this conventional way of correlations? We call it as Vada Vyadhi. We just correlate degenerative disc disease as Trigaprishta Kadigraham or Grudrasi or Vishwaji, and IVDP is translated as Kadi Kashirugandiriya Chakrachudi, but it's not working in treatments. Further descriptions of pathophysiologies of modern medicine only. We never go behind the Ayurvedic Samprapti. So correlations, no further analysis based on Ayurveda Samprapti, like real Hedu, its Vigalpam, its Ulpadaka Hedu, Vyanjaga Hedu, Udbhavasthanam, Sanjarasthanam, Vyaktasthanam, Yogavastha, etc. We go behind the modern pathophysiology. There is nothing wrong in that, but when it comes to treatment, we have to adopt Ayurvedic thought process. So regarding the treatment approach, we ignore the rational Ayurveda pathophysiology, that is Samprapti, imitating the modern medicine. We go behind the symptomatic treatments. So what is the conventional approach of the majority? The Ayurvedic versions of modern approach, that is rest, analgesics, muscle relaxants, anti-inflammatories, and physical therapy, we substituted with our Kiri, lot of starting from Yuksha Svedam to Shashtigam. So using under the, we practice all these under the misnomer, Panchakarma. A series of Sneha and Sweda, starting with Yuksha Svedam, Dhanya Mladhara, then Churnabinda Svedam, Patrabodala Svedam, Ushma Svedam, Pirinya Tadaval, Pirichil, ending in Shashtigam for strengthening. We call it as strengthening, but it is unscientific. Abhyangam, Segam, Piju, Kadivasti, Anuvasanam, etc. So then why the natural question, then why we often get positive results with this approach? Because it is these false positive results or symptomatic relief are due to suppression of symptoms due to amastambanam, which is very well described in the context of ama and jura. Just like hitting the snooze button on the alarm for temporary relief. We daily do this. So like that we get positive results. But what is the fate of it? Disease become chronic. We don't understand or we rarely identify it as it is due to treatment. High recurrence, over medication, long-term and repeated therapy, costly treatments, and poor quality of life. So here is an option. An unconventional Ayurvedic approach which is effective, cost-effective, safe, minimal recurrence, fast-acting, and scientific. So unconventional Ayurveda approach, there is nothing new in it, no secret formulations, only classical Ayurveda approach which we often fail to appreciate or accept. So it is not lifelong medication, we concentrate on lifestyle modification. That is the simple explanation. So here is an evidence, the true identity of scientific Ayurveda, its edge over the failures of conventional modern medicine, the need for a review on the conventional unscientific practices in Ayurveda. So a case presentation, a male patient of 37 years, he is from Jharkhand, he is a retired lieutenant commander, now working as a deputy registrar in Central University. He consulted me in the 7th month of last year. So the presenting complaints, suffering from back pain since last 8 months, was doing all the normal physical, this is a very, very important point, was doing all normal physical activities during this period, that is playing, running, driving, etc., while using painkiller, ointments, gel, spray, etc., and having physiotherapy. So history of presenting complaints, since last week of April 2024, the pain was gradually increasing, was not even able to stand properly. Consulted neurosurgeon, advised medicines, pregabalin, etc., Pan-D and Exrodol, and rest for 4 weeks, bed rest. The pain got reduced. Later, while on treatment, the pain transmitted to right thigh and right calf muscle. All the activities restricted as per doctor's advice. You can see the extruded disc. So you can see solely the canal's diameter was only 4.5, sorry, not 4.5, 0.45 mm in the place of 15 to 17.5. So it was very, very narrow, only 0.45. So severe lumbar canal stenosis was there. You can see the MRI report. And in April, he took an MRI, and in that it was 0.45. And in July, he took another MRI advised by the doctor. It was 0.32 only, 0.32 mm after modern therapy in July. You can see the previous report. Sorry. Oh, sorry, it is 0.32. Yeah, 3.2 mm. Yeah, sorry, 3.2 mm. You can see the report here. So recommendation by the modern medicine, physical symptoms were not severe, so they advised to take 4 to 6 weeks of rest and medicine, and physical medicine also, but surgery is certainly advised by 3 doctors, including from AIMS. So I had a very detailed, we were doing consultation through phone only. I got a very detailed lifestyle details from him through WhatsApp, and I have asked a question, how the disease is affecting your life. He told, not able to do my usual daily routine, including play, running, etc. Even have restricted body movements, which is mentally and physically disturbing. And I asked another question, what do you expect from Ayurveda approach? He said, complete relief from pain, no physical movement restrictions, should be able to play football, golf, do running, exercises after certain time. Should be able to live a normal life as I was living before. Disc bulge should be reduced to the minimum. So application of therapy to reverse the samprapti. So what is the basic principle of Ayurveda? The basic principle of treatment in Ayurveda is to assist the body in self-healing rather than suppressing symptoms. This is the main difference between modern medicine and Ayurveda. So importance is given to the stage of the disease rather than the disease proper. This is also a very, very important point to note. So the Chikitsa Sutram is Nidana Parivarjanam. We may identify 5 stages in any treatment plan. First one is Ama stage. Need to do Pajanam in Avarana, in Srodho Shodhanam. Second one is Shamanam. Third is transitional stage before the fourth one, that is Snehana, which is often ignored by the Ayurveda community, and substitute it with external Snehana, which is less potent. Or it could be Shodhanam followed by Shamana Snehavanam. Fifth is Rasayanam. So 5 stages of therapy. In Sama and Pachimana Avastha, you should do Nidana Parivarjanam and Pajanam. In the Pakwa Avastha, it should be Shamana, Aushadam, then a Hrasyasi Matra of Sneha, then Shamana Snehavanam and Rasayanam. So the first line, to follow a healthy lifestyle, to avoid food and regimes which cause tissue toxicity, mainly that is Ama, avoid heavy dinner. These are the things which I identify. Junk foods, highly processed food and reheated food, additives like black tea, black coffee, green tea, etc. Use Pajana drugs, also avoid external symptomatic treatments. So the first line is to avoid food and regimes which cause tissue toxicity. That was advised. The change in lifestyle which prevent Ama and its progression to disease, that is the aim. So these are the usual diet restrictions and suggestions from my side. I'm not going to the details now. So especially I ask the patients to avoid all these things. So don't suppress the self-healing with regimes and therapies and medicines in the initial stage. So I advise avoid symptomatic treatments initially, external suppressants like oil, labum, ointments and painkillers, including painkillers like avoid Shulakna Aushadha, direct painkillers, which is Kashaya Rasa and Stambhana. They give temporary relief and long-term complications. Especially, we will never be able to move from the Ama stage to the next stage of Snehana if you give these painkillers. Then avoid hair oils with the Shida Vidya. This is very, very important point which we usually ignore. So those containing aloe vera, henna, hibiscus, brahmi, neeli, etc. are very, very notorious to cause severe complications. And being a Kapha Pradhana Ama condition, I always, it's not from my part, Acharyas also say to avoid all type of external oils. Then green tea, black tea, etc. Then appam, a fermented cuisine which is very popular in Kerala. This is also causing severe complications. And adding rice into the batter of dosha and idli, that will also cause Ama and pain complications. So also a heavy supper is causing Ama, and re-cooked or cooked and refrigerated and reheated food. This is also very dangerous. So first stage of therapy is Ama stage, a metabolic or immune toxic stage. Here the symptoms and signs may be severe but should not suppress them symptomatically. So Ayurveda advised not to use direct painkillers, external applications, food and regimes which suppress symptoms, because it will only mask the disease process and make it a chronic one with remissions and exacerbations, that is Vishama or Leena dosha. So Ama, as per Ayurveda, the primary or basic pathophysiology and predisposing factor behind the progression and also prognostic and determinant of almost all disorders. That's why Jwara is considered as the basic disease, that is inflammation or toxic stage of body and mind. represent a stage or state of body in response to an unaccustomed stimuli. So this is the modern studies show the same thing. Modern medicine now accept this as a research puts into question the conventional practices of pain management. Blocking the natural course of inflammation with drugs could lead to harder to treat pain. The short-term fix could lead to longer-term complications. A study done in 5 lakh people. The inflammation occurs for a reason and it looks like it is dangerous to interfere with it. Treating pain with NSAIDs and steroids produce prolonged pain up to 10 times the normal duration. Study sample of 5 lakh people reveal that taking anti-inflammatory drugs to treat pain were more likely to have pain 2 to 10 years later. And it may be time to reconsider the way we treat acute pain. Pain can be killed in other ways that doesn't involve interfering with the inflammation. So they have started thinking differently. So this is our Acharya's explanation. Our fundamental texts highlight these ideas very precisely, but they have been neglected in favor of more contemporary approaches. So snanabhyanga pradehamscha parisheshamcha lankhanam should be avoided in the initial stage. And ajirna eva shulakhanam same tivra rujijjare na pibeyad aushadam. Even medicines can cause ama. So avoid symptomatic treatments initially, external suppressants like oil, labum, ointments, even physiotherapy, because parisheshamcha lankhanam include vyayama also. So physiotherapy should also be avoided in the initial stages. So there are many points to cover in the ama. I am not going into the details. So presence and absence of morning stiffness and night pain, rest pain reveal ama nirama stage. Assume and treat for ama, because many patients come in the masked form. Due to external applications and painkillers, the ama will be masked and it will be in the dhadugata stage, so the symptoms may not be present. So think before prescribing whether I am doing brahmanam or lankhanam. Diagnosing amavadam and prescribing thailam externally is unscientific. Use of oils externally inversely affect the healing even in degenerative diseases. So give importance to pathyam. This will ease amavajana and can be avoided many medicines. Use minimum medicines for better results. Medicine can also cause agnimandyam and amam. Shardharanam is not the universal amavajana drug. So it is a modifiable major risk factor. Unique concept need more study and consideration by the Ayurvedic fraternity. So these are the usual options which I take to manage this condition. So regarding the Kshanadi and Vyadhyavastha, it takes around 15 to 20 days to achieve Nirama stage, evident by absence of early morning stiffness, night pain, heaviness and swelling. So this was only 2 medicines were prescribed for the patient, Sindhuva Erandam and Dasna Saptagam. So review after 9 days, he stopped all modern medicines and was on leave for 10 days. After medication, still have mild but persistent pain at the lower back, numbness and weakness better, early morning stiffness in low back, mild present. So after completing 15 days, he was almost relieved of ama symptoms. So to manage the avarana condition, Saman Aushadam was prescribed with Nimbamradadi Erandam and Dhanada Nayanadi. It was continued for 2 terms, 15 days each. After that, back pain really very mild, tenderness mild present, morning pain has further reduced, radiating pain absent, weakness and numbness mild, advised to continue for another 15 days. With that, all the symptoms were relieved. Then shifted to Shamana Aushadam. So review after 15 days, back pain only on exertion, tenderness absent, morning pain absent, radiating pain absent, weakness and numbness absent. So third stage, the transitional stage, a smaller dose of sneha, medicated fats are administered along with shamana medicines to check the tolerance. This was followed by smaller dose of snehas alone. The positive results assured that the body has attained the non-toxic or nirama stage and it is fit for snehana, which is very, very important stage. So this was prescribed as transitional stage medicine. Then shifted to IP treatment. He was admitted in the clinic and undergone Madhyama Matra Taila Snehavanam, then Patra Bodala Svedam, Vaidaranavasti and Yabanavastis. So fourth stage, toning up of tissue. After the IP treatment, he was advised to take Shamana Snehavanam in his own home. To strengthen the system, this Shamana is done to achieve full symptomatic relief and normalcy of clinical examination or parameters. So Samana Snehavanam again with the Thailam was done at the dose of 15 ml daily morning. So the fifth stage, the compliance therapy with the Rasayanam to prevent the recurrence, prescribed Rasayana for 2 months, along with yogasanas for regular practice to continue healthy lifestyle, and he completed medication on April 4th, that is last month. So we could give good relief to the patient in 15 days and complete relief within 3 months, which modern approach couldn't give even after 8 months of management. Relief might have been faster if the patient hadn't received the prior symptomatic treatments. So I got his...
Good evening, sir. I'm Lieutenant Commander Ujjwal Kumar, retired from Indian Navy in 2020. Last year I was going through a severe pain, back pain, and before that I would like to prize that I was having a very good physical fitness, and even after retirement I was doing all the physical activities like running, playing, even especially I play golf. But last year in the month of early May, last April, I got a very sudden attack of back pain. Because of that I was for almost 1.5 months I was bedridden, almost completely bedridden. I went to the local doctors, basically neurologists and neurosurgeons, consulted I think 2-3 doctors in my local vicinity, that is Ranchi, where I am residing now. Everybody treated me, and with the painkillers and muscle relaxants I got a bit of relief in pain. But every doctor told me that I have to go for surgery because around 70-80% of the spinal canal was blocked because of the bulge in my L5-S1 disc. And it was unbearable. The pain was absolutely unbearable. I was not able to walk properly. I was not able to stand, and somehow I was managing my works, daily routine. In the month of almost July, when I was under medication and going to final treatment, I went to Delhi, including AIMS. I went to Spinal Injury Center in Vasant Kunj, Delhi, and Medanta, Gurgaon. And all the 3 doctors I shown, including AIMS, they told me to go for surgery because there was no remedy other than the surgery for this issue. As they told that even other type of physiotherapy and all can only can give me relief for some time, but ultimately I have to go for surgery for the final relief. Whereas I was very hesitant with that.
Regarding his present condition,
Presently, I am living a very normal life. A very, what I can say, it's absolutely fine. I can do my activities. I am going to my office in my own car with certain precautions, basically cushions and all. But I can easily drive. I can do all the activities. I have not started playing hard games like golf and all. But I can easily do the jogging part, and while doing all the activities, including some certain activities in my home, like some lifting of some items from down below to my first floor, everything is being done normally. So I am very thankful to Sir that with his guidance and the way he has treated me is really amazing. I never thought of that even after such a consultation or advice by the allopathic doctors. I may able to have this life again, and I'm following all the precautions which is being prescribed by Sir, and hopefully I think within a month or so I may able to do other physical activities, including playing also. So again I am very thankful to.
okay. So the highlights:
Present.
scientific, effective, cost effective, minimum medicines used, minimum period of treatment and hospital stay, could manage pain effectively and safely than modern medicine without using any painkillers from Ayurvedic side, could avoid surgery, no recurrence during the treatment period of 8 months and 1 month of medicine free period, and could provide good quality of life. Conclusion: Ayurvedic approach of lifestyle modifications and medicines process, the status of a safe, effective as well as a cost-effective option for most of the degenerative disease of the modern era. The need of the hour is to generate ample evidence for it in a scientific manner. So we need to change the way we think and act, accept and acquire modern knowledge, but think and act as per the guidelines laid down by Ayurveda. Thank you.
Thank you, sir. Thank you, sir. Thank you so much. I think, as usual, Shyamashan sir has opened up many points for each one of us to introspect in our prescriptions. So meanwhile, we move on with the discussion. Any questions from each one of you may be passed on to us, or you may raise your hands. We'll pass on the mic to you. So any questions, you do let us know. So sir, as we move on, all of you, I represent probably the voice of all our practitioners. So all of you have communicated your own points of view, and every one of you are rich with lot of experiences. So now if I ask you, maybe to Triveni sir, Shyamashan sir, Shashikumar sir, in the initial part, for an Ayurvedic physician, how important, sir has mentioned about Udbhavasthanam, Sancharasthanam and Vyaktasthanam, and all throughout everyone's presentation, how we had given importance to the neurological, locomotor, musculoskeletal examination, which would give us an idea about the anatomical aspect of the structural issue or the pathological issue the patient is presenting with. But when we really think of in Ayurvedic terms, in a period when these musculoskeletal examinations was not a part of our curriculum or our knowledge system, what was actually the strength of an Ayurveda physician to deal with the similar management strategies? Because we do understand, as sir was mentioning, the different Gadavatas, Rakta Gadavada, which presents with Santapam, Majja, Asti Majja Gadavada. When we go through the spectrum of Vatas, Gatavatas, Asti Majja Gadavada, which is Santatam Ruk is present in the case. So for an Ayurvedic physician, how important it is to understand the Samprapti in an Ayurvedic term and imply it in our clinics. your opinion initially, Triveni Suresh sir. മൈക്ക് വേറെ ഉണ്ടോ? വേറെ മൈക്ക് ഉണ്ടോ? സാറിന് അവിടെ ഇരുന്ന് സംസാരിക്കാം.
It reminds me of what my father used to do while treating some patients. During my PG time, one patient from Chennai came and saw my father. It was a case of syringomelia. So the word I started hearing only during that time. She had numbness in the limbs and also temperature, vibration sensation were all very less. And it was a diagnosed case of syringomelia. So I asked father how, without the knowledge of all this, how are we able to treat that? He told in various texts the hints of certain neurological disease have been told, and he considered this as not Gadavada, he considered this as a combination of so many vadas. And the first thing he started to treat was he started doing Panjamala-dhara. Panjamala-dhara is a one which now so many people are doing. It started during that time at Triveni, and the patient got very good relief with Panjamala-dhara. And he started giving Rasagandhi Meluga internally, Rasatailam, all these medicines have been given. So these people have, even though they don't have the modern knowledge how to correlate this, they have thinking in the right way and giving the proper medication. That is how they are effective in treatment. Other than that, Arshan, that's only thing, Aptavadesha, something, I don't know. But this is how I feel it has been done.
So the question is very pertinent. How to combine this Ayurvedic Samprapti features with that of the modern medicine practice. So one thing it is that Ayurveda never shut off the doors to modern medicine or emergency medicine, anything. Everything was aware there, but it is our fault to not to do research and develop it. Dvida Swatantra Paradantratva Vathaya, Antya Punardhada, Purvaja Purvarubhakya Jada Pascha Dvodrava. Tesham Pradhana Prasame Prasamo. When you take the principal disease, the complications will subside. Ashame Sada Paschal Chigilse. If the complication still remaining, likewise this deformities in Vada Shaunada, you suppress Vada Shaunada first, then you do for the treatment, even like physio or any other kidney, pedichil or something else. That according to that, will and see that the practitioner doctor, they are the full discretion to do it. And then Paschatya Turnam Va Belavandam Udravam. If the complication is very distressing and life threatening, Turnam Va, you immediately Turnam Maladra. You never look dosha, dusha or anything else. Ama Akni. You sustain the life of the patient first. Because if the life is not there, how you go to treat the patient? The Ayurveda practice, that is why the same emergency medicine they are doing. When you brought the patient to the casualty, immediately they will do ventilator support or oxygen support, any other thing, or anticoagulants or any other thing, or tramadol or any injection. If the heart attack comes first, they will tramadol or opium derivatives, whatever it may be. So Ayurveda practiced it, and I preached it also. But the thing it is that if you want to develop Ayurvedic medicine and Ayurvedic practice and give more insights to it, Ayurveda Samprapti is inevitable. A full understanding of Ayurveda. At the same time, the Ayurvedic Samprapti should complement the Ayurvedic side rather than fully doing what is called going to the modern medicine side. You see, the simple thing I will tell you, you see a MRI scan report. Underlined this is the finding only at the time of scan report. As with any law in medicine, exceptions may come. The scan report is not responsible for such eventualities. So such a scan report itself is writing like this. you have to understand what is the Ayurvedic Samprapti fully before executing the Ayurvedic. That is very important. Ayurveda also preaches like that. Tasmal Vigara Prakriti. The nature of the disease. Vigara Adhishtanam, site of manual. Vigara Andaram. Anyat Vigaram Vigaram. Differential diagnosis. Buddha Hedu, as Samson doctor said, Buddha Hedu Visheshamscha. Hedu Nidana, all these things, or environmental factors, stress fractures, or all these things, food, dietetics, etc. So that is very important because this Ayurvedic Samprapti is still alive, but the way we practice that we have to change. Dr. Samuel.
Yes.
Thank you very much.
Thank you, sir. So, as you mentioned, Tasmad Vikara Prakriti, maybe from Rati ma'am, I would like to hear your opinion. Tasmad Vikara Prakriti, Adhishtantarani cha, Samuthana Visheshamscha Buddhva, Kriyan Samacharet, Rogan Samacharet. I think Sangraham and Charakam gives the three things, adding with either you have to select the Kriya, Samuthana Vishesha, Adhishthana Antarani, that has to be understood. Even for selection of understanding Roga also. So in your clinical practice, for example, Vegarodham, that is something that modern medicine has never spoken about. So the practical observation of Vegarodham in patients with vertebral issues, whether it is cervical and other principles that you really, and I think inevitably everyone think of always making Vatanulomanam as a part. Every prescription has generally an Erandathylam if it is Vata Kapha Anubandhatvam. So your opinion in the issue, as well as your, clinically what are all the things that you understand in an Ayurvedic perspective before you take on a case?
For treating the patient, Ayurvedic etiology, thought process, a deep thought process regarding Ayurvedic etiology is inevitable. Modern medicine is for better understanding. Before we are getting to action of Ayurvedic treatment, we have to thoroughly assess these all points. That is my way.
Jayan sir, would you like to add?
See, what is Ama Acharya says, what Shamashan sir already mentioned it. Ushmana alpabeladhvena dhadu madhyam apajidam dushta mamashayam samamam projection. Ushmana alpabeladhvena. Here the Ushma means Dhatu. If the Dhatu is not properly working, the rasa Rekta become difficult. So while metabolism happens, rasa becomes rasa. So the Sara form of Rekta and the Kitta form of the rasa will be formed. So if the Dhatu is Manda, because of the Visheshana of the Vada dosha, the Visheshana of Vada dosha is Diktoshana Gashaya, Alparyusha, Pramita Bhojana. These are the things Vishates Vada Yoga. The Visheshat Vada dosha will cause Vishamagni. So the Dhadu Parinama is not properly happening. So the Kitta form of the Dhadu will be accumulated in the Srodhas. That is the importance of Amabhajana. In this case also, the Visheshat Vada dosha gets Thana Samsraya Astri Adi intervertebral disc and this bond after getting dosha samorchana producing disease. At that time, the Srodho Rodato will be there, the Amatto will be there. The first line of treatment is to Deepana Bhajana to specify this Ama. So also the second line is to eliminate these Ushya parts. That means the toxic products from our body. So that is the way of Sneha and Sweda to pacify the Vada. After the first line of treatment is to pacify the Vada. Deepana Bhajana. Then the second line is for the Vada dosha. For that purpose we are giving Sneha, Sweda, Shodhana. After that we have to, after purifying, cleansing our body, we have to think about the Rasayana. That will nourish. See, what is happening in our body? The oxidants will destroying our body. According to, we are thinking the modern view. The oxidants is destroying, antioxidants are, most of our rasayanas are antioxidants. When you have to apply, after the Shodhana Chikitsa we have to give. That protect the tissues. Am I right? So, Rasadhatogini, if the Rasadhatogini is not properly working because of the vitiation of the Tiktoshana, because of this faulty lifestyle, the Vata dosha may get vitiated. Vitiated Vata dosha will produce Vishamagini. Vishamagini will produce Dhadu Paranama, hindrance will produce, producing the Kittas in the Srodhas. Srodho Rodhata will be there. So first we have to specify Vama. For that purpose we have to give Kashayavana Padhyanir Deshaha Idilengide. Saprit Dadyal Kape Mande Vada Pitod. When you have to apply the ghee, Acharya very clearly said that. So most of the Ayurvedic products are antioxidants according to the modern view. When you have to give this rasayana only after the Panchakarma Chikitsa. First you have to remove all the oxidants from our body, follow these procedures. Keeping this principle in our mind, definitely you will get good result.
Sir, I think many in the online have asked about how did you manage that Hirayama disease that you had told in the first stage?
Hirayama disease is a very, 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 very rare condition where the only Vellore Medical Center, they have diagnosed it as Hirayama. It is they have also said that in the text. It is very difficult to see it. Where the dura mater is encroaching anteriorly and hindering the blood flow to the spinal cord, leading to the myelopathy, where the Srodhorodhata is happening. So the first line of treatment is give maximum rest to that area. The lower part of the cervical cord, spinal cord is affected. It is a cord lesion. Where also we can think the Amatha, Srodhorodhata is there. So the line of the treatment was, the principle of the line of the treatment is like this.
Okay, sir. Then coming to Shamakrishnan, sir. As you mentioned, what is your opinion on the topic that I had discussed? One thing. And secondly, sir, as you mentioned this understanding Samuthanam, then you advise lifestyle disorder, lifestyle change, you continue, you get up early in the morning, avoid late night dinner, XYZ. In the patient who is coming to us, I think most of them who are coming to us in the present scenario, maybe he is retired, so he was able to follow those things. So my practical question is, patients come to us and say, Ilya, I cannot do all these things, and he next moment goes to some other Vyajan over there. Then what is our say, sir? Can we go for some painkillers for initial symptom response? What's your opinion on that?
No, I never give that. Because most of the patients coming to me are coming after all the treatments, all modern medicine, and even after months of Ayurvedic treatments, they are coming. So they will obey the rules and they get results also. And regarding the patient, he is still working as a university. He is not a retired man. He is 32 years only. And he is working. And regarding the Samprapti, I think we have to observe the patients, just deeply observe the patients and their experiences. That is, first one is regarding the Anupashayams. They have undergone modern therapies, very scientific therapy. By giving physiotherapy, painkillers, so that is not working. So why we are again doing the same thing? You avoid that. That is Anupashayam for us. So avoid that. So we have other options which are very effective. We can adopt that. And regarding the lifestyle, we have to go deep into their lifestyle. And regarding the treatment, follow the principles as prescribed in the text. We have a very clear-cut description of the Samprapti. We have to derive some Sampraptis in the new lifestyles. So by observing patients, we can design the Sampraptis according to this era, and we can adopt the treatments accordingly. That is the solution.
Okay, sir. Any questions from our audience? Meanwhile, Triveni sir, Makaradvajarishtam reference or
Tamil yoga.
the two yogas arishtas, is it?
All are Tamil Marma yogas, which I can give.
Fine.
Yeah.
Madam, Marmakiri that you had mentioned.
Marmakiri is practiced in ISM department.
Which
traditional medicine.
Yeah, contents.
It contains Chenni Nayakam, Meera, Methi, Shadaguppa, Mashali, I don't know its Sanskrit name, Mashali, Godambu, Mahasha.
Okay.
Current department.
Thank you.
Dr. Remya, I had one question. we didn't discuss about the stress factor in these disorders. I want to know the opinion of other faculties.
Sir, stress in these issues background of spinal disorders.
It's a very relevant one. I have already included in it because due to time shortage, I have not touched those areas of Samprati. The main basic Samprati Khatakas is Prajnaparadham is there, and it is very, very relevant in the current era. I am doing that, and I am finding it very, very deep-rooted emotional suppression as the reason for many of the disease conditions, including this autoimmune disease and especially in cervical and lumbar diseases. And within few hours itself, they are getting relief of severe chronic pain by just doing this Sattva-Vajaya Chikitsa. We are getting excellent results. So that is a main factor in the current era.
Yes. Any other opinion, sir?
So this stress factor, it is a very important thing in this clinics, not only in Tigretra clinics. In Charaka, Sharirasthana, the first chapter, this Aktivesha is asking certain questions to Lord Atraya, Vedhananam Adhishtanam Kim. The reply is that Vedhananam Adhishtanam Mano Dehascha Sa Indriya. So wherever you get the pain, this mana and Indriya part is there. This thing that is now being used by the modern medicine, not by Ayurveda, is prophecy. They are considered that pain is classified into two things. One is nociceptive pain and other is neuropathic pain. If the pain is any pain, not only IVDP or any pain or any stress and stress is allowed to continue more than 6 weeks, it will turn to a neuropathic pain and it will be very difficult to treat. They clearly said, International Association for Pain Management, a subsidiary organization of WHO. So Ayurveda is well telling that.
Okay, sir. Thank you. So I think before we go for the... Yes, sir.
Regarding the psychological factors, it is the reason for ama also. Upataptena bhuktam cha shoga krodha bhayadibi. There also comes, and also in Abhigada, these mano vegas are also considered as the reason. So both Ulpadaka Hedu and Vyanjaka Hedu, the factor of manas comes. So it is very, very important.
So before we go for the concluding remarks from Ramanathan sir, I think 3 things from all of you panelists we would like to know is the practice. We know in all spinal issues, Vasti as well as Nasyam and Snehapanam that you had mentioned, Agni Karmam, bandaging. These are the possibilities that we have. So other than the Snehas Vedas and other aspects that you had mentioned. So in your experience, Nasya Yogas, which are all the common Nasya Yogas that you had practiced, up to what do you decide the Matra of Nasya Yoga according to strength of patient? Have you practiced, Madam was telling about Swarasa Nasya, have you practiced Swarasa Nasya? The different Nasya Yogas, different Vasti Yogas that you have found effective. Vaidarnavasti, which says Palashukti Karsha Gudbai Amli Guda Sindhu Janma Gomutrehi. Sir was telling it is Surabhi Payas in Vangasena Samhita, and Kshira Vaidarna was had its Udbhavam at that point. When the combination of Guda and Amlika with the Kshira is always considered an opposite possibility, but the practice is there as Kshira Vaidarnavasti, Ardhamatrikavasti and all spectrum. So in each one of you, before we end today's discussion, if we have any questions from our audience, your experience with respect to Nasyam, Vasti, each one of you, if you could communicate, we'll go for the concluding. Ajayan sir. Mike.
So, Vasti is found to be very effective because by considering the Panchapadas, I think Dr. Shashumar can say it very nicely. What about the Prana, Udana, Vyana, Samana and Apana? So we have to pacify, you have to normalize the normal functions of these Panchapadas. Says Nasya, widely I am not practicing. The Vasti I am giving. giving, because the Vasti Sthanam is, Vasti we are giving to specify the Vada. So, Brahmanasya, according to the article, we can say Brahmanam Vadaja Chule, Nasya, Sosha, Varasanga, like that. But the Sthana of Apana Vayu is the lower region. So, while giving the Vasti, that will normalize the functions of the Vasti. That is found to be very effective also in my clinical practice also.
Madam, different yogas that you are practicing.
Cholavasti, Erandamuladi Vasti, Vaidrana Vasti, Panjadikta Kshiravasti is very effective in degenerative cases. In AMA condition, I am practicing Chornavasti using Amradotaram Kashayam, Vishadharanam, Maradotaram Kashayam, Vaisharanam, Vaishanda Churnam, Gandharavastadi Kashayam, Avipati Churnam, Gandharavastadi, Vaishanda Churnam plus this Madana Phala and this Saindava. This type of Vasti, Saptasaram Kashayam, Hingutraganam, Hingvachadi Churnam. These types of Vastis are practicing. Nasya, Nargundi Sarasam, Nimba, Charanarigari, Nimba Sarasam, Nargundi Sarasam, Nasya mixed with the Kshiravela. First we are using Nargundi Sarasam. After that, when the Kapakshaya is noticing, then we add Kshiravela or Dhanandaram with this Sarasam. But for Swarsanasya, large quantity is using. In case of cervical spondylosis and cervical spondylitis and degenerative changes, it is very effective, and it is very effective in Pakshakada, where the infract is the reason. In hemorrhagic conditions, we are not using this Swarsanasya. One more thing, I am practicing Vamana, which is Pratiloma Shodhana. It gives good result in lumbar disc bulges.
So Nirgundi Swarasa leaf, madam. And then you are adding Kshiravela Taila to this Swarasa, separate avasthas.
7 days Nasya is
Nirgundi Swarasa.
practicing, and 1, 2, 3 or 4 days Nirgundi Swarasa alone. After that, when Kapakshaya is happening, then we are adding Dhanandaram, Vishuddhavada, Kshiravela, Avaranavada, like that. Okay.
I think we have a question on online that in the case you had explained about Agni Karmam, where and what changes would you observe with Agni Karmam, and bandaging, where did you do in the lumbar area?
Pain points, Agni Karma did in pain points, right leg, bandage, certainly good relief. In not in this case, in all cases we are getting pain relief while using Borvanna bandage.
Then you had mentioned about Kubja Prasarini Taila.
It is mentioned in Bhaishya Ratnavali, and it is higher in result than Karpa Sastya. We are using in Amsa related or Bahu related pathology, Kotan Chukadi, Karpa Sastyadi, Padnidagiri Shiradi. Kubja Prasarani gives more action than these 3 drugs, and it is more potent.
Thank you. Suresh.
For Vasti, what we usually follow is Madhuyashtyadi, Madhudailigam, Yoga Vasti. But of late what we do is Pippalyadi Anuvasanam for first 2 days, then Madhuyashtyadi as the main drug for, that's how we, for all pain condition, it is severely told that for severe pain we can use Madhuyashtyadi, and it is giving us lot of relief. And for Nasya, we usually don't use. In case if we need it, I have only one option, Kshiravela or Anudaila. That's all we do.
Okay, thank you, sir. Jain, sir. Sorry, Shashumar, sir.
Vasti is the prime treatment. Another thing it is that the Vasti is a highly flexible treatment. That is a Vasti being adopted, because it can be done with Prasada Yaugika Vasti, Yabana Vasti, Ajayabana Vasti, because they are even fit for what is called kings and rulers. They cannot take rest. So they can be done. So usually being done is said by the Vasti is that this Madhudailigam Vasti is a choice, because it is good for diabetics also. Because a patient will not come to you with only IBDP sometimes. You may have so many comorbid conditions. Diabetes is a very frequent now. 1:1 or 1:2 is a diabetic or a pre-diabetic. Pre-diabetic is as bad as diabetes. You don't preach about diabetes. So that thing means in such conditions, Mahadevali is Rasayanam, Prameya, Harsha, Krimigun, Mantra, Pradijit. It is Rasayanam, regenerative purpose, as well as it is good for diabetics. Panchagata Shira was the another option. And another thing, and Vaitarana was the both types. Gomutra and Shira is another option. And Dipanjamuladi Vasti is there. Dipanjamula Seraso, Amla Yukta Sachaga Mamsasya Purava Kalaka, Trisnaka Yukta Pravaro, Niruga, Saru, Anilavyati Hara Pradishta. So that is a very good option, but it can be done alternately either as a yoga vasti or yoga vasti and kalavasti and karma vasti is very difficult because due to the one what is called this financial constraints as well as long hospital stay again. So yoga vasti is the best option in some conditions. Rajayavana vasti is another condition if there is severe what is canal stenosis. That I mean, but is called towards the end of the treatment. That is just before what is called the Rasayana treatment that we are giving. That is another thing. So the Nasya is also good. It is a Kanona Prasanna Skandavi Asya Vachasa, the Dendya Abelida, Pavayur Nasya Shidina. That is Skanda Griva Asya Vachasa. So it is giving more strength to that area. It is clearly said in Ayurveda. But because that individual cases should be there and precaution should be taken and how much we can manipulate with the patient. And because inadvertent manipulation with the cervical spine is very dangerous. One have to see. Atlanto-axial joint, Atlanto-occipital joint, and the lower spine joints, because their craniosacral flow is there, see through sea level. Atlanto-axial joint is there. If it's a second and third vertebra, first and second vertebra, hangman's fracture, all these things can come. You have to be very careful while manipulating cervical spine. So first you see what is severity of the disease and you execute the treatment. That is the only thing.
Panchadiktaka Vasti that you were mentioning was Nimbamrita Vrishapatola
that is Panchadikta.
not the Siddhistana
That is
Yoga
first 5 days of Gukladitaka Yoga.
Yes.
And then Nimbamrita Vrishapatola.
Fine, sir. Okay. Thank you, sir. Shamashan, sir.
I am using Nimbamrdadi and other Erenda for Nasyam, and mainly I am using Dhananjaran Taila only. And up to 3 to 5 ml in each nostril I am installing. And regarding the Vasti, I am using a modified Vaidarana Vasti with a change in Dravadrivya. That is, I am using Dhanyamla instead of Gomutra and Kshiram. And also then Arthamatrika Vasti, then Yabana Vasti, Kshira Vasti. These are generally done.
Erenda Thailam in the initial stages, sir. Like Madam was mentioning about Swarasa, that is the stage, or how do you decide Erenda Thailam Nasyam and then?
So I usually do Nasyam only after the Vasti.
After Koshta Shodhana, Urdhva Jadro. Fine, sir. Thank you. I think any questions from our audience? No. Fine.
Sir, you told green tea is contraindicated. As per modern, it's full of antioxidants and polyphenols.
Antioxidant in Amalagam is 300 times more than green tea, a cup of green tea. So which one will you prefer?
You told it's addictive and contraindicated.
Why you are taking a tea, a black tea or black coffee? What is the logic behind that? Why you are taking that? What is the need?
Apart from addictive, we can use it as for general nourishment and.
It is not nourishing. It is never nourishing.
Now that I told, it is told as per modern antioxidant.
It is an addiction-inducing thing. That is the only logic behind that. Nothing more than that. Cause addiction. That is why you are asking that question.
The continuous use of green tea, it is Lusha in nature.
Lusha and Amastamana. It is Kashaya Rasam. It causes Amastamana. We are taking dinner, heavy dinner, and we are producing Ama. And in the morning we are suppressing it. So we have a Vishama Swabhava Yogas for almost all patients. There will be recurrence, there will be chronicity will be there. And that Vishama Swabhava we can see in many patients. When we stop the medicine, there will be recurrence. It is all due to these things. If you quit tea, nothing will happen. You will get cured of all degenerative diseases. I have done a study on that. I have given dissertations to house surgeons to observe the intake of green tea and the occurrence of osteoarthritis. It's very evident. You yourself can study it.
Sir, it's told that in many in skincare and all, they advise green tea daily. That's
Many things, nothing is omitted today. Everything is applied on the skin,
and also
including vegetables, fruits, everything.
and also, sir, how can we tell hypermetabolic persons about early dinner?
Yeah, that will subside when they take food earlier.
There is a chance they will get hunger.
No. That is psychogenic only. It's very clear. I am practicing that. I know. I take only 2 times a day food. Nothing will happen. It's only
I am a
psychology.
hypermetabolic person.
No, that will change. That is due to acidity only. If you change your diet, it will subside.
Simya, you can arrange immediately if that category is security. Otherwise, tea market will collapse. Tea marketing business. Tea marketing business.
Sir, I think we will conclude, sir. Thank you all. Bishajam sadhuvrittana, Badram Agamashalinam, Abhyasta Karmana, Badram Badravilashinam. So, wishing for Badratvam of everyone who is actually wishing for Badratvam of the world at all levels. I call upon Ramanathan sir.
Question from the, I think 500 people are still waiting.
Question, sir.
And that is, I know giving.
Already we had answered, sir, almost ella, except a case.
They are waiting for that. Yes. Please justify.
Myasthenia gravis is not coming under our pertaining. Ada njan choikathu. Myasthenia.
Anu കൊടുത്തില്ലേ?
So almost I think all questions they have asked is covered. So I think I'll call upon before we end Acharya Rasanam, Ramanathan sir for his case experience and concluding remarks. Sir.
Our today Acharya Rasanam is totally different because it's online and offline. And more than 600 online is continue. Now the up to 2:30, I saw that more than 450-80 people are still continues. First time in the, because why? Because of the very good, they are getting very good experience and information, and also they are got a good knowledge also. That is why they are running the. Sorry for the online participant due to the running time. We not fully compromise your questions. Anyhow, you send it all the anything for the email. We can share to the participants, and they'll give the answer also. So what is today's Acharya Rasayana difference? The difference is today 5 Shyamakrishan and Shachikumar, Suresh, Redi Vyunithan and Jain. You know all the names. Shyama Krishna, you know Shyama means black, but he is white Krishna. And Shashi is a moon. And Sura means, maybe what is the Sura? No, Sura is a victory. And Jain is another victory. You know what is the Redi's meaning? He is a character, that is a rhythm. He says, these poor people here, that is already suggestion. No, that is killed driver. So what is the difference today? What is the day? Mother's Day. So Ridhivi Nitan, you have done very good job regarding your experience. First you are present all the paper and very experienced. And today also I have done number of times in Asya and also practice the Kabla. Today I understand what is the purpose of the Kabla, because without Kabla, that is a chances for the infection. Thank you, sir. This is the experience that we have done all the time. After Nasya, you practice Kabla and Dupamana. We don't know the practice, what is the purpose of that. So today I got the knowledge. What is the purpose? Otherwise you are not getting proper the kabla. There is a chances for the infection. The good knowledge. This type of the knowledge we need. And spread it. So then everybody asking what is the purpose of the kabla? That is a today practice. That is a you are asking to the anything the chat GPT. Then getting with the 30 seconds will cancel. So this type of the answer we can include at the chat GPT. This is our duty. So then automatically the younger generation will attract to the Ayurveda. And another one, the Shashi, the answer of the paper, he has explained how to diagnose this properly. So we don't know this idea, but still I am practicing daily, weekly 5 to 10 back pain. It's success also. Suppose I study this matter properly and go to the treatment set, what is my future also? That I think now. That why I told it here, you can study it properly without I have given my experience. I think doctor is there. One patient back pain, I ask you to the table and ask you to raise a leg. First leg raise and second leg and both leg it is not possible. I am very happy. Then I give you information within 5 days. My job, I will cure it and all the giving assurance. Otherwise, I am ready to pay money. That type of the heroism, because it's very simple. It is not possible. It is one leg is possible and another leg is possible. It's not possible to the two legs because that is the information is there. So simple. That is Karinuchi Rasam, Sindhuara Thalam, and some mementos from application. And if possible some band-aid. Case is success within 5 days. So every people, especially in Kerala, the back pain is very easy to. Then second stage, that is a difficult. So we can go the proper diagnosis. That is the Shamakishan is already done. That is using L5. L5 area is below 3. So it's wonderful. And after the 1 month treatment, he is completely pure. He has mentioned the audio level in discussion also. So all this 5 presentation is very informative. This type of the information we want to, what is our job in future? You give the Ajar Rasayana, it is already 5 research articles are there. We need more research articles. I think who is the main problem in Ayurveda? Don't mistake with Shamakishan, don't mistake Sachkumar, Sudesh, Devi Nitan, Dr. Jain. You are the main problems are there. Don't mistake me. Why? Dr. Jain, how many research papers are presented? Devi Nitan, please raise.
No,
Shashi sir, you, sir.
Really, I am a troublemaker.
Thank you. No, we come to all our stand up. All our stand up. Please. Why you are giving the good applause? For what is purpose? Their job, publish at least one journal within 2 months. What you want? Then give the applause. Please. Sir, are you ready, sir? Ready, sir? Madam, are you ready? What you want, be ready, sir. Because that is the present situation. Yeah. Don't mistake it. It's not that is a need now. Don't no, you have very good experience. We have enough application. So you give this type of the support. What happened? That is what is the main problem of the social media. We have no scientists. I already mentioned today morning the issues of Wikipedia. This type of 1 or 2 presentations enough, Shamakishan. We can prevent the social media issue because this type of the experience we need. So you are a very reputation. You are what you want. We can arrange a team also. We are ready to fund for that. So you want to tell me, sir? Tell me. We give you all support because otherwise it's industrial. That is Ayurveda system survival is very difficult. Sir. That is why. Then that is why I think today I am very glad that today is a Nedibi Unithan's day, that is Mother's Day. So the Mother's Day, so we are getting a blessing also. So I am sure, Ramya, today's meeting successful and good compromise. And our Dr. Aditya is and very all the people and Dr. Anu and Rubesh and Dr. Everybody is a teamwork. Today is our success of Sridharan teamwork. So thank you very much, Ramya, for all your success. Thank you once again, all the participants. Don't mistake me. I want to give in 1 month time. Otherwise, all the people come to your hospital. Garao, sure. We can go to Garao. It is our job. We don't waste it. We are ready. Everything promised. Why you are not sharing the proper knowledge? It is our duty, sir. Thank you. Thank you, sir.
Thank you so much. How unique, how invaluable knowledge it was flowing. Even being a general audience, I got many information on Ayurvedic science. Thank you so much. So it's time to introduce our esteemed panelists to receive the felicitations arranged here. To felicitate Dr. Shyama Krishnan, retired District Medical Officer, ISM Department, I invite ASM Vimal. Dr. Ratibi Unithan, former District Medical Officer, ISM Department, CEO of Unithan's Ayurvedic Hospital and Research Center, Changanasheri. I invite Dr. Anu Joy, Research Officer, Sitaram Ayurveda. Dr. Sridevi, Research Officer, to felicitate Dr. C. Suresh Kumar, Managing Director and Chief Physician, Triveni Nursing Home, Trivandrum, Professor of Shalyagandra, Pankaj Kasturi, Ayurveda Medical College. Felicitate Dr. V.K. Shashikumar, Medical Superintendent and Senior Consultant, NS Ayurvedic Hospital, Kollam, retired District Medical Officer, ISM Department. I invite MD Dr. Ramanathan Sir to felicitate him. To felicitate Dr. T.S. Jayan, Founder and Chief, Madhaviyam Hospital, retired Joint Director, ISM Department. I invite Rupesh, GM Sales. Special mention to Dr. Remya, who was there as a moderator for such an insightful session. So, to felicitate Dr. Remya, I invite Dr. Aditya Panikar, AGM, Sitaram Ayurveda. Felicitate Dr. D. Ramanathan. I invite on behalf of Sitaram family, Dr. Remy. we know, for an official ceremony, there should be a vote of thanks. So, introducing Mr. Rupesh CR, General Manager. We are pleased to welcome him, a veteran in the pharmaceutical industry with over 27 years of experience in both modern and Ayurveda sectors. His expertise lies in building robust sales network, driving growth, and leading high-performing teams across India. As the General Manager Sales at Sitaram Ayurveda, he heads the national sales operations, ensuring the reach of the products to every corner of the country. So please join me in inviting Mr. Rupesh for the vote of thanks.
Good afternoon, respected doctors. I hope the experience shared by the renowned and senior doctors and the evidence-based medicine which is launched today will give a good impact on your practice for enhancing your practice as well as give better cure as well as better lifestyle to your patients. I take this opportunity to special thanks to our respected MD, Dr. Ramanathan sir, for his great presence in his busy schedule. Once again, I'm giving a special thanks to our expert panel doctors who has given a wonderful presentation and shared a beautiful experience to improve the practice of the new doctors who came here. Especially respected Dr. Shamakrishnan, Dr. T.S. Jain, Dr. Reddy B. Unithan, respected Dr. V.K. Sachikumar, respected Dr. Suresh Kumar, and respected Dr. Ramanathan sir. So once again, I am taking this opportunity to thank all doctors who are presented here. Even this today, I think there is a lot of personal functions are there. So even though in difficult situation also they have participated well and they honored our invitation. So once again, thanks to all doctors who attended this program. And I take this opportunity to thank our Sitaram team and the Sitaram crew for making this event a successful and knowledgeable sessions to all medical fraternity. Thank you.
Thank you everyone. As we conclude, as Rupesh sir said, thanking everyone here, and your presence and engagement means it a lot. So wishing you all a great day ahead. Kindly enjoy the sumptuous lunch set up outside the hall. Thank you and namaste. Thank you. Playing the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात